Good morning, sir.
Yeah, good morning, ma'am.
Ma'am, shall we start, ma'am? So, good morning, sir.
Good
Principal,
morning,
sir.
Gitanjali. Please start.
Okay, sir. Thank you, sir. So, good morning, everyone. I'm so happy to see you all again in our international conference series. I heartily welcome all our participants and speakers to this beautiful morning. Learning gives creativity. Creativity leads to thinking. Thinking provides knowledge. Knowledge makes you great. By Dr. APJ Abdul Kalam. With this quote, we shall move on to today's session. Once again, I welcome you all to the day 4 of Sciences-Icarp 2021, International Conference on Advanced Research in Pharmaceutical Healthcare Sciences, organized by Faculty of Pharmacy, Dr. Enger Educational and Research Institute, in association with Pharmacy Council of India and Indian Pharmaceutical Association, Tamil Nadu State Branch. Before going to the day 4 event, we shall have a short summary on day 3 event. The session started with an educative explanation on neurodegenerative disease by Ms. Subhashini Raman, Product Specialist, Department of Pharmaceutical Engineering, University, Malaysia. After her disseminate talk, we moved on to the next session with our another eminent speaker, Mr. Venkataramanan Sir, Research Fellow from Italy, who presented his talk on the topic hepatitis C virus and hepatocellular carcinoma. And finally, the session was concluded by the discussion of queries from the participants. An e-certificate was presented to the speakers by our beloved principal sir as a token of appreciation. So without any delay, furthermore, we shall progress to today's session with another 2 more experts who are present here to enlighten us with their valuable talk. Now, I'm very happy to welcome Dr. Palaniswamy Sivanandi Sir, Department of Pharmacy Practice, School of Pharmacy, International Medical University, Kuala Lumpur, Malaysia, who is going to present on the topic Importance of Mental Health During this COVID-19 Pandemic and Ways to Achieve it Normally. Followed by our another speaker, Dr. Mahendran Segar Sir, Associate Professor, Faculty of Pharmacy and Health Science, University, Kuala Lumpur, Malaysia, on the topic drug delivery of natural products in brain for neurodegenerative disorders. Once again, welcome you, sir. The one who questions much shall learn much and retain much. So I request all the participants to post their queries in the chat box, which shall be discussed at the end of each section. Now, I would like to call Dr. S. Dhanlakshmi Ma'am, Associate Professor, the Faculty of Pharmacy, Dr. Enger Educational and Research Institute, for introducing the speaker of our first session, Dr. Palaniswamy Sir. Over to you, ma'am.
Thank you, Mrs. Gitanjali, ma'am. Good morning. Good morning to all. I take this opportunity to address today's speaker, Dr. Palaniswamy Sivanandi, Research Expertise. Dr. Palaniswamy Sivanandi is an eminent academician and researcher, has more than 15 years of teaching and research experience. He has more than 22 years of experience in the pharmacy field. He has started his career as a dispensing pharmacist in 1997 as diploma pharmacist. 2005, he has completed his undergraduate from the Madurai Medical College, Tamil Nadu. In 2007, he obtained post-graduation in pharmacy practice from Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore, Tamil Nadu. He has completed his PhD in the year 2013 from the prestigious Tamil Nadu Dr. MGR Medical University, Chennai, and good clinical practice license exam from the Ministry of Health, Malaysia in 2014. He has published more than 75 research papers in various national and international indexed peer-reviewed journals and is serving as a chief editor and as an editorial board member of reputed more than 10 international journals. He has received many grants from the Indian Council of Medical Research, New Delhi, India, Department of Science and Technology, New Delhi, India, Center for International Cooperation in Science, Chennai, India, and International Medical University, Kuala Lumpur, Malaysia. He has presented many research papers in the conference in various countries like Turkey, United States of America, South Korea, Singapore, Thailand, Indonesia, Philippines, India, and Malaysia. Dr. Palaniswamy has awarded Outstanding Researcher in Pharmacology Award in 2018, Education Leadership Award in 2019, Global Knowledge Management Award in 2020 and Dynamic Pharma Researcher Award in 2020. IMU Achievement Award in 2020 and AKS Global Faculty Award in 2021. His main area of research is cardiovascular and diabetic medications, oncology, pharmacovigilance, drug safety monitoring, prescription auditing, clinical research and development, clinical trials, patient safety, social and administrative pharmacy. Today, Dr. Palaniswamy sir going to enlighten our webinar. We welcome you, sir. Dear participants, if you are having any questions during the presentation, please type them into the chat box in your Zoom. I will bring them up during the presentation and we will also have the questionnaire session at the end. Now, without further delay, I will welcome Dr. Palaniswamy sir. Sir, now the forum is for you, sir.
Okay, thank you, ma'am. Thank you for the introduction. First of all, I would like to thank the management of Dr. MGR University, as well as faculty members for inviting me to deliver a talk in this conference. Okay, I'm going to share my slides now, just to have a look. If you're not able to see my slides, just let me know. Okay. Hope you can see my slides, right?
Yes, sir. Yes, sir.
Okay, very good morning to everyone. And for us, it's a good afternoon, actually. So I thought it's a 12 o'clock because my time difference is there, right? So I fixed my calendar as at 12 o'clock. Normally, I fix my time as a 12, half an hour before any event. So that's why I came a little bit early. Okay, so for the delay, we'll go. Okay, very good afternoon to all the members, all the participants. And I'm Dr. Palaniswamy Sivanandi from the Department of Pharmacy Practice, School of Pharmacy, IMU. So today I'm going to talk about the importance of mental health during this COVID-19 pandemic and the ways to achieve it naturally. So last 2-3 days, I've seen a lot of topics related to your subjects. And this topic is not related to the subject, but this topic is related to our life. Okay. We don't know what will happen today or tomorrow or day after tomorrow, right? Because now we are in the uncertainty. So we have to know what will happen in future and how to cope up the problem associated with the pandemic. Okay. So why we need to talk about this topic today? Is it essential? Okay. So before getting into the topic, we will see some of the facts related to the topic today. Okay. A recent study published in the Journal of Medical Internet Research says that due to the long-lasting pandemic situation, as well as a continuous lockdown for more than 1.5 years, okay, and we are there at home for last 1.5 years, right? So this pandemic period, as well as the lockdown, brings negative outcomes or the impact on the higher education, especially with the college students. Okay, so now the college students are attending the classes online. And most of the time, we can see maybe physically present. Even the physical class also, some students will be physically present and mentally absent, right? So now we are in the online classes, and most of the time, we don't know whether the students are receiving our teaching or not, the teaching and learning process. Okay, so it negatively brings a lot of impacts on the higher education. And this study further suggests that there is an urgent need to develop interventions and preventive strategies to address the mental health of college students. Okay. So another study published in the BMC Psychology, this study says that 25% of both German as well as the UK respondents experienced severe worsening symptoms of the COVID-19 related stress and anxiety. Okay, as well as there are 20 to 50% of the German and UK respondents had the depressive symptoms associated with the anxieties as well as the COVID-19. And this study also explained there is a need for tailor-made intervention to support this type of large populations of the general public. Coming to another study, this data was taken from the CDC, Center for Disease Control and Prevention. This data says that an average, you can see the picture here, the blue color one, For the duration of 6 months between January to June 2019, around 11% of people reported they experienced the severe symptoms of anxiety or depression. So this data for a period of 6 months in the year 2019. Okay, only 11% reported that they had a symptoms of anxiety or depression. But however, in the year 2021, in the January month, the single month alone, there are about 41% of people reported they experience severe anxiety or depressive symptoms. You see the number, increasing the number. Okay, in 2019, there is no COVID. But last 6 months, in 6 months, the total number is only 11%. But you see, within a single month, 41% of people reported they experienced severe depression or anxiety. The data further says that there are about 35.8% of people experienced severe symptoms of anxiety disorder. At the same time, there are 28.4% of people experience depressive symptoms. However, it's a very, very pathetic situation. You see, there are 41% of people experience both depression as well as anxiety during the period of 1 month. Okay. So you see here another data. So this data explain about the age group most commonly affected by the depression as well as anxiety. Okay. So among all the age group, the adults aged between 18 to 24. So normally the school going students, the college going students will be falling under this age group. That is adults aged from 18 to 24. There are about 56% of adults aged between this age group experience severe depression or anxiety. Okay, and between the age group of 25 to 49, 48.9% of people experienced depression or anxiety, as well as there are 39% of people between the age group of 50 to 64 experienced the severe depression or anxiety. Okay, but the depression level is, when compared to other age group, the depression level is very less in adults. There is geriatric people aged between above 65 years old, because they are habituated. The people above 65, they will not go out. Mostly they will be a retirement age, or they will be doing some household work, and they will be very, very, passionate to sit at home. But we are not like that. We always we are always going to office or college, and most of the time we'll be outside, right? So this lockdown brought us a lot of health issues as well as the mental health problems. Okay. So another data published from the Lancet Psychiatry, this data says that the people with the depression, anxiety, or obsessive compulsive disorders experiencing more severe form of the anxiety and depression. Already they have some amount of depression, anxiety, but during the lockdown period, okay, all are in the uncertain situations, all are running back to take care of their health, and they're not putting much efforts to give attention to this kind of people. So this problem, the COVID lockdown, all the problem associated with the COVID-19 brought a severe problem in depressive, anxiety, as well as obsessive compulsive disorder patients. Okay, so this pandemic situation is not only good, not only bad for the healthy people, even it produces a lot of health issues or increasing the worsening of the symptoms in other people as well. Okay. So we know that how to prevent the COVID-19, right? The spread of COVID-19. So we know that there are 6 steps, the primary steps we are following to prevent the spread of disease. The first one is we have to wash our hands. At least minimum 20 seconds we have to wash our hands running tap water with using a soap or hand sanitizer. Okay, and the second one is whenever you are not allowed to touch your nose or eye or mouth, okay, with unwashed hands, because the dirty hands may bring the disease or the organism to your body. Okay, so we are not supposed to touch our nose or mouth with unwanted unwashed hands. At the same time, most of the time the government is asking us to stay at home for long period of time, right? So wherever is possible, whenever is possible, we are supposed to be at home. We are not allowed to go outside, otherwise you will get kicked from the police officers, right? So the third thing is we have to the lockdown. Okay, and the fourth one is whenever possible, okay, we have to maintain at least a 6 feet distance between one another. So this will prevent the spreading of disease. And the fifth point is we have to close our nose and mouth whenever we are coughing or sneezing. Okay, and we have to clean our place, maybe your table or maybe your computer or maybe your mobile phone, whatever you are touching frequently, that area should be very, very clean. The object as well as the area should be very, very clean. You have to clean it, right? So these are the common steps normally we are following to prevent the spread of the disease. And most importantly, you see the third one, stay at home. The government asking us to stay at home. Okay, it is not even a single day. You see, last 1.5 year, almost 18 months, we are at home. Even there is a flexibility in India. Sometimes they are imposing lockdown, and sometimes they are releasing it. Okay, so maybe 2 weeks, 3 weeks, then after that they are releasing the lockdown, and we are allowed to go everywhere. But in most of the country, even you see in Malaysia, we have lockdown almost for last 1.5 years. There may be a strict lockdown or maybe relaxation lockdown, but the lockdown is there for more than 1.5 years. Okay, so staying at home is not easy. You can see the Vadivel comedy, right? Okay, simply sitting at home is not easy. It's not possible for everyone. So now the government is asking us to stay at home to prevent the transmission of infection. You see, you know, the busiest city in the new world, there is a New York City, is in the lockdown. And another city, there is a Paris in the lockdown. Then Moscow is also in the lockdown. Kuala Lumpur, the capital city of Malaysia, also in the lockdown for the last 1.5 years. Sydney is in the lockdown. Then our country, India, also in the lockdown. So almost all the countries are in the lockdown. Okay. So maybe some of the government faculties are getting salary without any deduction, and they are enjoying the life. Okay, but it's not easy for the private company employees, private institution employees. Some of the institutions are giving full salary, some are having 10% deduction, 20% deduction. Okay, so there are a lot of issues are there, you know. Okay, so this problem, so what are the problem we are associating, what are the problem we are facing in the lockdown period? Okay, so we are spending limited time spending with our neighbors and the relatives and friends. We are not able to go out, we are not able to go and meet our friends or relatives, so we are spending very, very limited time, right? And most are working from home, and some are taking rest, and some are working very hard, and students are going through the online classes. Few people lost their job. That's a pathetic situation, you know. Now the last 1.5 year, no recruitment. Even though they give an appointment order, they said don't come. Okay, we'll let you know when you can join. So there are a lot of problems every sector. Okay, and few others had salary reduction or due to pay. You see, there are a lot of problems associated with the lockdown. This unprecedented situation put a lot of pressure over employee as well as employer, then the family, kids, and all other people. So it is this problem is not only for the employee. Okay, even the employer also facing the same problem. They are not getting more number of students. Okay, and there are a lot of issues. Even in the hospital, you see the other people are not going to the hospital. Mostly the hospital will be completely filled with the patients. Now only the COVID patients are going, other people are taking their treatment at home. So hospital also, they lost the revenue. Okay, and the family, how long you can be at home, how many times you can see your family members again and again. So is it possible to see your spouse 24/7? No. So the problem for the family as well as kids, the kids are not spending the time. Okay, and it has directly or indirectly created pressure, tension over everyone, and lack of job security. We don't know what will happen in future, when they will reduce the number of staff, when they will ask us to go, right? So lack of job security, economic imbalance. So no income, no savings. So whatever we saved already, we are utilizing now, right? So there is an economic imbalance and workload. Most of the time, the government offices are closed, right? So we are keep on accumulating the task. So workload is keep on increasing. Okay, and whatever we can do outside with others, we are not able to do it. So the workload is keep on increasing, academic as well as non-academic, and the personal work all are increasing. And family quarrel, as I said earlier, when we are sitting at home, we will talk something, finally we'll be getting some problem. right? So the family quarrel is very, very big problem now. Even the family quarrel and the family disputes, the number of cases of family disputes increased during the pandemic period. Okay, and most of the time we are postponing our important assignments because lack of money, lack of resources, and lack of availability of people, and lack of officers. So this problem put what is that? Compelling us to postpone the important assignments. Okay, and we are unsure about future. What will happen? We don't know. Even though we are at Malaysia, we don't know what will happen tomorrow or day after tomorrow. If you die here, I think that they will not bring our body to India. So we are not sure what will happen, right? Even you can see, even every day in the Facebook we can see some of our Facebook friends died, or maybe their relatives died. So we can see the condolence messages every day, the WhatsApp group, Facebook group we are seeing. Okay, even though government recording some number, I see the number is not correct. Even maybe we'll be having 4,000 people, 5,000 people in our Facebook group, maximum, or 5,000. Okay, even the 5,000, every day we are seeing almost 4 or 5 deaths. You see the number, right? So there is unprecedented situation. There is a lot of unsure about the future. Okay, so this contributed a lot in the development of stress, anxiety, and depression. Okay, so what is stress? It's a kind of feeling where one may feel being under abnormal pressure. You may feel that you are in a pressure. So always you may feel you are in a pressure. So that pressure is a stress. You may think that I'm in tension. That tension is a kind of pressure or a stress. Okay, so a feeling abnormal pressure is that stress. Okay, this abnormal pressure may come from various aspects, maybe from your day-to-day life, or it may be due to increase of workload. Okay, and sometime what you will do, okay, I don't want rasam, you prepare sambar. I don't want sambar, you prepare chicken curry. And someone will say, don't want chicken curry, you prepare mutton curry. Okay, so you are keep on increasing workload to each and everyone. This increasing workload may put stress. Okay, may create stress. Then the provisional period, financial crisis, and argument with your family or friends. So this may contribute stress, development of stress. Okay. Next one is anxiety. Anxiety is another emotional characteristic. It's characterized by the feeling of tension, as well as worried thoughts and physical. This worried thought and feeling of tension may increase the blood pressure. Okay, it may cause a lot of physical changes, including the blood pressure. Okay, and they may avoid. So the people with the anxiety, they may avoid the situations out for worry. So they are not ready to face any problem. Always they may be in the worried tension, worried behaviors. So they don't want to take any activities. They will sit at home. They'll be very, very calm. Okay, so they may also have physical symptoms such as sweating, trembling, dizziness, as well as a rapid heartbeat. Okay, if you have any of these symptoms, you have to think that you may be in anxiety. Okay, and depression. See, depression you cannot easily find out. So depression is a serious common medical illness. It is a very, very serious common medical illness, and most of the time the people may have depression, but we cannot easily find out. Okay, this may lead to various physical as well as emotional changes in all the aspects of the person's life. Sometimes the depressive patient may commit suicide. Okay, because initially it's asymptomatic. Once you didn't diagnose the depression in the early stage, it may end up with a life-threatening situation. Okay, so coming to the complications associated with this problem. So whenever you are in stress or anxiety, or due to the stress and anxiety, if you take more amount of alcohol, nowadays the task is open. If I'm starting a business, I cannot get 500 crores of money within 2 days. Right now, you see the taskmark, they opened the taskmark within 2 days, they got 500 crores of money from the taskmark revenue. Okay, because nowadays the alcohol consumers are more. Right, so the stress and anxiety bringing another way, go and take alcohol or go and smoke. So the people are consuming alcohol. Then lack of sleep. So during this pandemic period, we lost our life. We lost our sleep pattern. Okay, the lack of sleep or inadequate sleep, or maybe we can say irregular sleep. Okay, and unhealthy diet. Now in our home, we are thinking that we are guinea pig, right? So most of the time, whatever they wanted to try, they are trying with us. They are preparing lot of several dishes and asking us, okay, eat this one, eat this one, this one. Okay, so unhealthy diet. Then dehydration, lack of exercise. The gym are not open. Even though we are at home, we are using your mobile phone 24/7. We are using mobile phone 24/7. We are not doing any work. Even we are not ready to help our mothers. We are not ready to help our spouse. But we are habituated to use only the mobile phone or the laptop. Okay, and smoking. So all these the unwanted habits, unwanted practices contributes towards a suppression of immune system. It will directly or indirectly affect your immune system. At the end of the day, the immunity will be very, very less. Then what will happen? We know that the immunity is like a boundary or a barrier, right? If the immunity is not there, if the gate is open, anyone will come inside, right? Now we are opening all the ways to welcome the disease, and the disease will come and attack our body, right? That is the thing what we are doing now. Okay, so we know that the healthy body as well as healthy mind, both are very, very important for a happy man. Okay, maybe you will be very, very good. You may have a biceps, six, very, very good body, and you will be a very muscle man. But if you don't have good mind, if you're a stress patient, if you're a psychiatric patient, what you can enjoy? Nothing. Correct. At the same time, you have a very good mind. You are a very good mind. You have a very big orator. You are a very big staff. You are a very big researcher, but your body is very, very weak. You are always falling in sick. So what will happen? You can't enjoy your life. So healthy body as well as healthy mind, both are very, very essential for to be a happy man. Okay. Then there's another study says that there are 9 out of 10 patients receiving some form of physical health check during the pandemic period. Okay, this is a report from the USA, and the study further says that 1 among the 3 adults smoking tobacco. You see, the numbers increased during the pandemic period, 1 among the 3. And around 60% of adults had both mental as well as physical health morbidity during the pandemic period. Not even a 1 or 2%. 60% of patients or the 60% of adults experiencing any one mental or physical health morbidity during the pandemic period. Okay, so all the data are evidence based, Okay, so what will happen when we are in stress or when we are in depression, when we are in anxiety? It will increase our heart rate as well as it will increase our blood pressure. Okay, once heart rate is increased, once the blood pressure is increased, it may contribute a lot of health issues in our system. Okay, and also the stress may increase the stress hormone level. When we are having more amount of stress, the stress hormone level will be more. So the increased stress hormone will create stress over all the immune systems. So thereby the immune system will be suppressed. Okay, and also whenever we are in stress, the stomach will not work properly. The gastric system will not work properly. So this may lead to gastrointestinal disorders. Okay. So coming to the negative effect associated with the stress, anxiety, and depression. So what will happen? It may directly affect your skin. So the skin will lose the texture. It may lose your tone, and it may lose your moisture. Okay, and sometimes it will produce some skin infection. Okay, the stress is a very, very important problem, important culprit to cause a lot of health issues, even the skin disorders. Okay, some patient may get the dermatitis. Okay, stress-induced dermatitis, lichenipoid patches. There are so many things are there, and the stress will affect the immune system. It may weaken the immunity. Then it may produce hormonal imbalances and increase the cortisol level. Okay, then it can affect your bone. So demineralization, decalcification leads to fragile bones. Okay, then the stress can affect your brain, may cause fatigue as well as reduced concentration or decreasing your mood. Then the stress can cause the cardiac system, affect the cardiac system, and may produce increase of heart rate, elevation of blood pressure. In the gut, it may produce gastrointestinal problem, and the muscle, it may produce muscle breakdown. Okay, so the stress will cause a lot of health issues, Okay, you know that Sushant Singh Rajput, right? Whether he committed suicide or he murdered by someone, I don't know. But the data says that before his death, he was observed with a lot of what is a stressful situation. Okay, he was observed with a nervousness, stress, and anxiety before his death. Okay, so again, you see another study. The first case of student suicide reported in India during the pandemic period, and the parents of that student said he was in stressful situation during the period. The first case of suicide is reported, and the patient committed suicide because of the stressful situation, because of the pandemic period, as well as the studies. Okay, now the COVID-19 suicide, not only in the student, not only among the students, even the suicide tendency also increased among the couples, so the COVID-19 suicidal behavior among the couples, as well as the suicide the incidents are increased during this pandemic period. So this is evidence-based study published by the Psychiatric Research Journal in the year 2020. Another thing, there's a suicide mortality and coronavirus. So there is a the blasting of suicidal tendency occurred among the people during the COVID-19 period. Okay. Then, because of lot of suicides happened in Kerala among the college students as well as school students, the government of Kerala begins effort to reduce the suicides. So they brought a lot of interventions, and they provide a lot of counseling to the students to prevent the suicidal tendency. Okay. So sometimes you may have doubt, do I have stress or anxiety or depression? Okay, because it's a common, right? Because we are always talking about stress, anxiety, depression, pressure, tension, blah, 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 all the stories. Sometimes we used to say, I am in tension. The tension may be a depression or maybe anxiety or stress. You may think, I'm not feeling good. I'm always having headache. The headache may be a symptoms of your anxiety or maybe a depression or stress, but we are not neglecting, we are always neglecting the symptoms, right? So sometimes we may have the doubts, do I have stress or anxiety or depression? Okay, so what you can do, you can go to the internet. In the internet you can see a questionnaire, that is DSM questionnaire. D for donkey, S for stress, okay, and M for mental health. So DSM-5 questionnaire, you can download the questionnaire, and you can use this questionnaire to check whether you have stress, anxiety, or depression. This questionnaire is having 13 domain and 23 questions. Okay, 13 domain and 23 questions. So each and every domain explain whether you have depression, anxiety, or stress. Okay, I will explain only few items here. The first item, domain 1, first item, little interest or pleasure in doing things. Okay, sometime in your family, maybe you may have kids, or maybe you have siblings, or maybe your family members. When you are asking them to do something, they may say, no, I will not do it. Okay, otherwise they will postpone the things. Okay, so if they keep on postponing something, or if they keep on telling that I will not do, so you have to check their mental status. Okay, sometimes suppose not at all means 0, little interest or pleasure in doing things. If you don't have that problem, you can put 0. If you have slightly, you are not interested, then you can give 1. And sometimes maybe weekly twice or thrice you are not feeling good, you are not interested to do something, means you can give 2 marks. Then more than half of the day, if you feel the symptoms, you can say 3 marks. And if every day you have the same thing, okay, if you're asking something to do today, he will say I will do tomorrow. If you're asking tomorrow, he will say day after tomorrow. He will keep on postpone the things. Okay, at that time you can give 4 marks. So based on the ratings, based on the score, you can check whether the particular patient or particular student, or maybe the particular family members having depression, anxiety, or stress. Okay, so here the first domain explain whether you have depression or not. The second domain explain about the anchor, and the third domain will tell you about whether you have mania or not. Okay, sometimes we have mania, flying like feeling. Okay, and fourth one, anxiety. Like that, each and every domain assess different parts of different aspects of the mental health. Okay, so you can use this questionnaire, the DSM-5 questionnaire here. You can use this questionnaire. It's a self-rated questionnaire. You don't need to consult a doctor. You don't need to go to a clinic to assess your mental health. Okay, so you can download from the Google website, and you can use this questionnaire, and you can assess your mental ability, your mental status. Okay, if you feel you have severe score, the score is more, and you have depression, anxiety, or stress, then you can consult your doctor and you can get appropriate treatment. Okay, So coming to here, how can we manage or overcome our stress, anxiety, or depression? Right? Okay. Now you see there are 15 items are there. These are the natural therapy. To overcome your stress, anxiety, and depression, you no need to go to hospital. You consult your doctor. Okay. Simply you can manage yourself without taking it, without spending even a single penny. You can reduce your stress. You can your anxiety as well as depression. Okay. You see, I have listed 15 items here. The first one is exercise, meditation, deep breathing, sleep, then writing, time management, avoid smoking, alcohol and drugs, diet, herbal supplements, aromatherapy, reduce caffeine intake, spending time with the family members, friends, and animals, laughing and music, yoga, cuddle, avoid common triggers of sad, stress, anxiety, and depression. Okay. Is there any problem in the slide? Is there any problem? Because we are watching the slide for almost a few minutes, right? Okay. Is there any problem in the slide? Okay, I will tell you. There are four fours are there, right? There is a sleep and writing. There are four fours. And is there any difference between the right side item as well as the left side items? The right side items, okay, having a bullet point, but the left side items don't have any bullet points. Even though you are watching the screen, your brain is working properly, but you are not able to identify these issues, right? So if you're not identified, if you have not identified these things, you have to think that you are in stress, right? It is very visible, nothing is highlighted here. So everything is very visible. You are seeing from your eyes, but you're not able to identify because you are not focusing. Your concentration is impaired. Okay, so this indicates that you may be in stress, anxiety, or depression. Okay, so for that, you have to use the questionnaire to find out in which form, whether you have mild, moderate, or severe form of depression, right? Or anxiety or stress. Okay, so coming to the natural ways, how can we overcome all these issues, stress, anxiety, and depression? The first one is exercise. Okay, normally when we do exercise, okay, we can be happy because the stress hormones such as adrenaline as well as cortisol level will be reduced when we do exercise. Make sure that the adrenaline as well as cortisol level will be elevated when we are having stress. So when we do exercise, normally stress will be less, the stress hormone level will be less. At the same time, it will stimulate the production of endorphins. So endorphin is a natural painkiller and mood elevator. Okay, so I'm not asking you to do what is that, severe exercise, high intensity exercise. Even you can do some mild intensity exercise or moderate intensity exercise. Okay, so according to your convenience, you can do any type of exercise. Okay, so high intensity exercise will release endorphins. However, the low intensity exercise will help you to release a protein called neurotropic factor. Okay, so thereby you can reduce your stress, anxiety, and depression. Okay, and the second one is meditation. So for doing meditation, you don't need to have a separate room, or maybe isolated room, or maybe a silent room. Even along with your animals, you can do the meditation. Just close your eyes, sit comfortably in an area. Okay, you can bring your family members, maybe your relatives, or maybe your kids. Animal also you can take. You can sit comfortably and do some meditation. So whenever you do meditation, you can bring harmony to your life. It will improve your focus as well as your memory. It will balance your emotions, and also it can increase your immunity. Okay, then it will reduce the stress and depression. The meditation will regulate your heart rate. It can increase your happiness. Then also, when we do meditation, our body will be in the resting stage. It can generate energy. So we will be feeling, you may feel you will be energetic. Okay. So coming to the next one, deep breathing. So what is deep breathing and normal breathing? So whatever we are doing is a normal breathing, that is chest breathing. But deep breathing should comes from the belly. Okay, so deep breathing is another way to overcome the stress, anxiety, and depression. Okay, so there are six steps are there. You have to follow these 6 steps. One is you have to sit and lie down comfortably in an area. Then close your eyes, because if you're opening your eyes, it will distract you. Okay, so sit comfortably in your area, close your eyes. Okay, place one hand on your chest, another hand on your stomach. Place one hand on your chest, another hand on your stomach. Okay, now after placing your hands, okay, now breathe deeply and slowly through your nose. So you have to breathe in slowly as well as deeply through your nose. Okay, at the time you can see your stomach is coming up, the stomach will rise. Okay, normally when you are breathing, the chest will come up. When you are breathing in, the chest will come up, and when you are breathing out, the chest will go down, right? But when you are doing deep breathing, your stomach will come up because you are taking more amount of air inside. Okay, so breathe in slowly as well as deeply through your nose and hold the breath for 5 seconds. Okay, 5 seconds, 5 to 10 seconds you can hold your breath. So this will help you to retain the energy inside your body. Okay, then after that, breathe out through your mouth. Breathe in through the nose and breathe out through your mouth. Okay, so when you are doing these things, you may feel your stomach is full and filled with the air. Okay, and breathe out slowly through your mouth. At the time you can feel the stomach is going in. Okay, so repeat this procedure 5 to 10 times every day. You make so this will reduce your stress, anxiety as well as depression. Okay, so there are different types of breathing is there: abdominal breathing, diaphragmatic breathing, belly breathing, and paced respiration. So all these breathing is to help you to get rid of your elevated heart rate as well as the respiratory rate. Okay, so thereby you can prevent the stress, anxiety, and depression. Okay, and the next one is sleep. So during the pandemic period, our sleep pattern is changed. We are getting into the bed, maybe we are lying down on the bed maybe at 10 o'clock, but actually we are sleeping at 12 or maybe 1 o'clock or 2 o'clock. Some are sleeping very early morning only. Okay, because our sleep pattern is changed. The sleep is very, very important. You know, the sleep will help you to repair the body. It will help us to get it is good for our heart. It will regulate the heart rate as well as the respiratory rate. The sleep will reduce the stress. It will improve our memory. Then it will control our body weight, as well as it can improve our overall well-being. So sleeping is very, very, very important. How much we are sleeping, how long we are sleeping, what is the quality of sleep. So all these three factors will decide the quality of our life, right? So what I have to do, you should follow a simple rule to get a good sleep. Okay, there are some simple rule is there. If you're following that simple rule, you will get a good sleep. Okay, the first one is follow your routine bedtime. So if you are going to your bed for 10 o'clock every day, means follow 10 o'clock. Okay, maybe for the first 2 days you will feel you will not get sleep. Maybe suppose daily I'm sleeping at 12 p.m. Sorry, 12 a.m. every day, but I wanted to start sleeping from today at 10 p.m. 10 a.m. So 10 p.m. Okay, so every day I'm sleeping at 12 a.m. But today onwards, after the talk, I wanted to sleep from 10. Okay, immediately you will not get sleep at 10 p.m. today. Maybe you have to start today and tomorrow, and day after tomorrow you will get sleep at 10 p.m. Okay, because your body is habituated for the resting stage the last 2 days, so third day automatically you get sleep. Okay, so follow your routine bedtime schedule and avoid using electronic gadgets, either maybe a tablet or a mobile phone or any laptops, okay, before 30 minutes before going to the bed. Okay, then if you're not getting sleep, do some relaxation exercises for about 30 minutes before the bed. Okay, you can do some mild exercises, you can do some breathing exercises. This will help you to get sleep. Okay, and otherwise you can read some books. You can take some books and you can read. Okay, so when I was studying at Madurai Medical College in 2001 to 2005, you know, sometimes I will not get sleep because for the exam period, for the exam time, I used to sleep only 3 to 4 hours per day. Most of the time I will open my book and study. Okay, so once the exam is over, even though the exam is over, after the exam also I will not get sleep because my body, the last 1 or 2 months, my body habituated for the wakefulness. Okay, so mostly before the exam I will sleep only 4 hours, but after the exam I will not get sleep. So what I will do, Whether it is correct or wrong, I don't know. Okay, I will take the Satya Sodhana book. You know, the Mahatma Gandhi book is there, right? So that book I will take. Okay, I will read. I'm not able to complete. If I'm reading the book, started reading the book, even I cannot complete even 2 pages. Immediately I will get sleep. So you can read some books for getting sleep, but make sure that you are not reading Facebook. Okay, if you are reading some other book, you will get sleep. If you are reading Facebook, the Facebook will kill your sleep. You will not get sleep. Okay, and always try to have a dark room or minimal light room, and this will increase your sleep. Okay, the sleeping tendency, and you will get good sleep. Okay, and try to have a quiet or low noise room for sleeping, and this will improve your sleep quality. Okay, then you can do some breathing exercises. Okay, and the next one is writing. When we are in the 90s, 80s, 90s, we used to write a lot of letters. Okay, before the internet and before the mobile phone, we used to write letters to our relatives, friends, everyone, right? Now we are not at all writing. Most of the time we are typing something on the computer, and it's not a kind of writing, you know? Okay, and the writing is different. So we forgot all the writing and expressing our feelings. So try to write something. Okay, maybe you can, suppose you forgot to give love letter to your girlfriend, maybe 10 years before, 20 years before. Okay, nothing to worry. You write some love letter to your girlfriend, but don't post it. Don't give to them. Okay, you write whatever you feel. You write in a paper. At the end of the day, tear the paper and put it down the dustbin. Okay, and you can see a surprising news. During the pandemic period, many people published lot of research articles. Even from Tamil Nadu, there is an university. The university published 300 articles within a period of 6 months. Not even 1 or 2. 300 articles within the first 6 months once the lockdown started. Okay. So they are focusing in different way, writing journal articles. Maybe you can write manuscripts, stories, poem. Maybe you can ask your family members. You can give some tasks to your family members. Write 200 words or 300 words, maybe 1,000 words about a particular thing. What is COVID? Or maybe you can give any theme, any topic you can give to them. You can ask them to write. Okay. At the end of the day, you can give some. You can offer some gift, maybe a chocolate. Anything you can give. Okay. So this will divert their mind. It will ask them to focus on a particular area, and they will get rid of the stress, anxiety, and depression. Okay, writing is another good way to avoid all these mental issues. Okay, so the creative writing will help the children as well as teenagers to manage a stressful situation. Okay, the next one is time management. So most of the time we are not focusing on our work. Most of the time what we are doing, we are postponing our assignments. We are postponing our work. Okay, because we didn't set the target. We have to set the goal correctly. Which one should be, what are the things we have to do? Okay, so list out all the works, whatever you want to do. List out all the activities. Then prioritize which one should be done today, which one should be tomorrow, and which one should be next week, next month, like that. So prioritize your work. First, list down all the work, then prioritize the work, whatever you want to do, then set time limit. So this work I wanted to do within a day. So this work may be next week. This work may be within a month I have to complete. So set a time limit. Okay. After that, even though you have a lot of work, you have to take adequate break in between your work. Okay, you have, even you see, I will put a list on. Maybe 30-40 items will be there. I have to do this one, this one, this one. So I'll, once I complete the particular work, I will strike out. But here it will keep on, the workload will be accumulated. So the page will be always full. So if you are committed to do work, you will be having more work. So the more work indicates that you are progressing. In your list, to-do list, if your to-do list is empty, it indicates that you are not progressing. You should have some list, and the list will tell you whether you are progressing or not. Okay, the list should be updated every day. So set your goal, prioritize your work, set a time limit for each and every work, then take adequate rest in between the work. Okay, organize yourself. Even though we are working from home, even though we are studying from home, okay, wake up early morning, then go to toilet, take shower, then sit and take your book. Whether it's online class or maybe face-to-face class, or maybe you are reading your own. Okay, sit, be organized. If you want to take breakfast 9 o'clock, means go 9 o'clock and take breakfast, and 12 o'clock lunch, and 8 p.m. Dinner. Like that, you have to organize yourself. If you're not organizing yourself, it indicates that it will welcome all the disease. Okay, maybe you will put up weight, you may get a lot of cardiac issues. You see, the cardiac arrest, the heart failure is very, very common below 30. Many people below 30, 40 is dying because of cardiac arrest, because of sedentary lifestyle. So we have to be very, very careful. Then we have to organize ourselves, and whatever we feel not as essential, we have to remove the task. Okay, if you feel the particular work is not necessary, this will not help me to grow further, remove the work. Okay, then plan well in advance. Okay, so time management is very, very, very important to avoid the stress, anxiety, and depression. Make sure that, please remember, we don't have the time machine to get the time what we lost. Okay, so be organized and be punctual in doing things. Okay, and the next one is avoid smoking, alcohol, and drugs. As I said earlier, in the last year, in 2020, the government closed the TASMAC for 45 days. The government closed the TASMAC for 45 days, but still the death rate was very, very less. During the 45 days, the death rate was very, very less. No one died stating that I didn't get alcohol, so I committed suicide. Right? The 45 days last year, no one committed suicide and telling that I didn't get alcohol, that's why I committed. Now you see, once I open the TASMAC, within a day, within 2 days, within a day, 250 crore rupees, and another day there is 240 crore rupees we spend for the alcohol, liquor. How we are wasting our resources. We can live without alcohol. The alcohol is meant for foreigners. You know why? Because they are eating the bread, burger, all the fermented products, bread, burger, pizza, whatever they want. Okay, that pizza, burger will not produce alcohol. So they need to take alcohol. They wanted to warm up their body because their area is very, very cold. So they need the heat for their body, the temperature. That's why they are taking alcohol. But we are living in a tropical country and we are getting temperature almost 35 to 50 degrees centigrade every day. But what is the need to take alcohol? Whatever you are taking, the porridge, the palay sadam will create alcohol, right? Whatever you are taking, the rice, it will create alcohol, it will produce alcohol. But what we are doing, we are simply following everything from the Western countries and we are taking alcohol. It is not at all necessary, our body can generate alcohol. You study the biochemistry, you will come to know how our body produces alcohol. Because they used to take beef, pork, all the meat products. The Westerners, they used to take meat products. Okay, so they have more tendency to have atherosclerosis, hypercholesterolemia. That's why to lyse the cholesterol, they are taking alcohol. But here, what we are doing, we are taking limited amount of fat products. Most of the time, we are taking carbohydrates, but we are taking more amount of alcohol. Okay, so what happened during this pandemic period? Many started taking alcohol. Okay, maybe initial period, maybe within 1 day, within 1 hour, 2 hours, you may feel very, very excited after taking alcohol. But at the end of the day, you will get very, very poor quality sleep. Okay, so this poor quality sleep, the next day will bring you hangover, headache, all the health issues. Then it will ask you to go for toilet, TASMAC. Then it will ask you to buy alcohol and consume it. Initially, you're not required to take alcohol. Because you are taking alcohol, this alcohol working on your brain and impairing your sleep pattern as well as sleep quality. So next day you are getting hangover. This hangover, okay, this hangover asking you to take alcohol again. So the cycle will be repeated, right? Don't think only alcohol will produce hangover. Even if you're taking sleeping pill, the next day morning you will have mild sleeping, the mild dizziness. It doesn't mean that you have to take another tablet in the morning. Today night you are taking one tablet for your sleep, and next day morning you are getting a mild hangover or maybe a dizziness. It doesn't mean that you have to take another tablet in the morning. But the alcoholic people, they are finding reason for taking alcohol again and again, and they are suppressing their immunity. You see, more as I told you earlier, most of the youngsters below the age of 40 getting cardiac arrest because of the sedentary lifestyle as well as unusual social habits, the alcohol and smoking. Okay, and the study says that the smoking will contribute stress. The current smoker experiencing 50% of current smoker experiencing stress, and 35% of former smokers, they're experiencing stress. Only 31% of non-smokers experiencing stress even during this pandemic period. Okay, then the another study says that 1 out of 3 people, those are taking or experiencing substance abuse, having depression. That is 1 among the 3 substance user getting depression. Okay, so avoid alcohol, avoid smoking, avoid drugs. Okay, and the next one is the diet. As I said earlier, now we are treated as a guinea pig. Most of the time the family members are trying all the foods with us. They are preparing different kinds of food, oily foods, the fried foods, and they're asking us to take it. And finally they will ask the feedback. How was the food? Whether it's good, whether the fried is whether it's fried properly or not, right? So they are trying with us, but at the end of the day we'll get all the health issues. You know, we can see how many people created video, food preparing video in the YouTube. There are many posts we can see. There are millions of videos uploaded during this pandemic period, how to prepare this food, that food, everything. But all these videos, more than 90% of videos are concerning about the oily preparation, the oily foods. Okay, how to fry this one, how to fry that one. You see, damn sure that maybe after this pandemic period, we'll be getting more number of diabetes, hypertension, cholesterol patients. In each and every hospital, there are a lot of patients will be getting diabetes, hypertension, as well as the cholesterol, because our food habit is not good now. We are not food conscious. Okay, so how to avoid the stress, anxiety? We can take some fruits like cherries, bananas, lemons. Then we can take broccoli, cabbage, okay, garlic, asparagus. So these fruits and food will reduce the stress. The another one, the avocado, whole grains, asparagus, almonds, milk, turkey, blueberries, orange. This will increase your healthy life. It will reduce your anxiety. The orange is very good for even the COVID patient, because having citric acid, the citric acid fruits will increase immunity. So you can have a good veggie life. You can take non-veg, but along with the non-veg, take adequate quantity of vegetable items, fruits, vegetables. This will reduce your stress as well as anxiety. Okay, and don't use same oil again and again. If you're using the same oil again and again, or maybe if you're using the similar type of oil, then you will get a lot of health issues. Okay, all the health issues will directly impact your brain function, the mental status. So always you can use olive oil or grapeseed oil. You can use some other vegetable oils, or eat some omega-3 containing foods or supplements. Okay, it will reduce your stress, anxiety, as well as depression. Okay, so apart from that, herbal supplements, even though we are taking a full plate of meals, we cannot say I'm taking food nutrients, all the nutrients. Okay, the quantity of meals will be very, very bigger, but it doesn't mean that all the essential elements are present inside the meals, right? So most of the time we are using fertilizers, the pesticides, all these things. At the end of the day, we are taking only the waste materials. It is not filled with the nutrients. Only the waste materials only we are taking daily. Okay, so how to boost up our what is it? The lack of supplements. We are supposed to go for buying some herbal supplements. You can buy the herbal supplements from the nearby pharmacy, because all these products are OTC products. No need to get a prescription for these supplements. Okay, so you can buy the supplements and you can consume it. I'm giving some example here. The herbal teas, lemon, what is it? The mint or lemon preparations, valerian root, kava kava, ashwagandha. All this help you to get rid of your the stress, anxiety, and depression. Okay, we can take the valerian root. The valerian root is very, very good for enhancing your what is that mood. This will relax your muscles as well as your stress. Okay, you can take St. John's wort. It's a very good product for elevating the mood. And another one is ashwagandha. When you're taking ashwagandha, you can reduce your stress as well as anxiety. Okay, then the kava kava is a very good mood enhancer as well as stress reliever. So you can take a kava kava. Then chamomile tea also, another one product. It will give you the mood elevation. Okay, so you can buy these products from the nearby pharmacy. For this, you don't need to consult any doctor, because all are herbal products, and it's considered as OTC, over-the-counter products. You can buy and consume it. Okay. And the next one is aromatherapy. So in a home, we may have either 4 or 5 people, right? So most of the time, the home will not be tidy. You see, the whatever we use, the used cloth will be there on the bed, and whatever we take. Okay, now you can see your the dining table. Dining table will be having all the items, the makeup items, then the food items, then your dress, everything will be there on the dining table. Dining table only for the dining items, right? The food items, but all the things will be there on the dining table. When you go to your bed, along with the pillows, along with the bedsheet, everything, you can see all the used clothes, right? And at the end of the day, your room or maybe your home will be having a bad smell, a foul smell. Okay, this foul smell or unpleasant odor inside the room will create lot of pressure. It will indirectly create pressure, tension, right? So make your area, make your room or the home very, very pleasant one. You can use some scents, lavender, rose, vetiver, or maybe chamomile or orange blossom. You can use any type of whatever you like it. Okay, you can use some room freshness to make the area very, very pleasant, and this will reduce the stress, anxiety, as well as depression. Okay, and the next one is caffeine intake. Before the lockdown, I used to take only 1 cup of coffee or 2 cup of coffee every week. I used to take only 1 or 2 cup of coffee every week. But now, every day, I'm taking 2 cup of coffee. Morning, 1 cup of coffee, and evening, another cup. I know that is not healthy. But what happened? At the end of the day, we are in stressful situation. We need something, right? We are not able to go out. Mostly, I will not be like this. Okay, every year I will go to 2 countries. Every year I used to visit 2 countries. Okay, I will attend many conferences. Okay, I will give many talk in the many events. Even during this pandemic period, I given more than 50 talks. But the thing, during the pandemic period, we are not going out. We are not allowed to go out. So at the end of the day, we are getting stressed. So to reduce the stress, we are taking coffee, tea, or maybe alcohol, or maybe smoking. Okay, we know that it is unhealthy, but you have to reduce it, right? So reducing caffeine intake is very, very essential. Many published studies says that caffeinated energy drinks negatively affect the mental health. Okay, particularly in the young consumers, it's negatively affecting their mental health. Okay, maybe maybe the initial dose, the small dose of caffeine may produce wakefulness or it may relieve pain, but at the end of the day, it may produce a lot of adverse outcome on the mental health issues, mental health. Okay, So the next one is spending time with the friends, family, and animals. So most of the time we are at home, we are 24 into 7 at home. But when you're talking about the quality spending with the family members, okay, it is very, very limited. We are not qualitatively spending time with the family members. Most of the time we are fighting with them. We are always giving orders. We are always arguing with them, right? So we are not spending the time qualitatively with the family members. Maybe we are spending quantitatively. Quantitatively is good, maybe more, but qualitatively you are not spending, right? So spend time with your family members, friends, or relatives, okay, and this will release the oxytocin, okay, and this oxytocin is very, very good for our health. It is a natural stress relieving hormone. This will reduce the stress, right? And if you don't have any family members at home, maybe you are living alone, don't worry, you can have a pet, you can cuddle with a pet, okay, you can spend some time with a pet. So the pets are a very good companion for love and support, you know. Okay, another one is laugh and music. So you can laugh wherever possible, whenever possible, you can laugh. Okay, so laughing is an exercise. It will relax your muscles. And also when we laugh, it will improve the respiration as well as circulation. Okay, and also it increases our immune system. Whenever you're laughing, you have to laugh, but don't irritate others by laughing. Okay, so you can say some jokes, maybe you can laugh with your friends or family members, do something. Okay, so the laughing will elevate your pain threshold, and it also create your tolerance. It will reduce the stress, anxiety, tension. Then when you are laughing, it will improve your mental functioning as well as memory. Then the laughing will improve the relationship with your, maybe with your family members or maybe with your neighbors. Okay, and it also promotes psychological well-being, and it will improve the quality of life. Like laughing, for laughing you don't need to pay any money, right? So without even a single penny, you can get a good quality life. And another one is music. Okay, so you can hear music. Maybe you are a bathroom singer or maybe a very good singer. Don't bother about it. Don't bother about the donkey's noise. Okay, don't bother about anything. Sing some song, whatever it may be. Okay, maybe it's a very good song or very, very sad song, whatever, maybe you sing some song. So the singing song will reduce the stress. It's a way of reducing the stress. Okay, and the next one is yoga. So yoga, it's not a religious one. Yoga is approved by the WHO, and also even many Arab countries approved the yoga. Okay, so yoga is very, very good for reducing the stress, anxiety, and depression. A study published in the International Journal of Preventive Medicine says the yoga will reduce stress, anxiety, and depression in women. When compared to men, the women are getting more benefit from the yoga. Because most of the time we are going out, the gents, we are going out, we are chit-chatting with our friends, maybe we are taking bike and roaming here and there. But it's not possible for the woman, you know, they are simply sitting at home. Even though they're a working woman, after reaching home, they will not go out. So most of the time they are spending time at home, they may have a lot of chance to get stress, anxiety, and depression. So yoga is very, very good for them to reduce all these problems, you know. Okay. Then the study published from the Harvard Medical School says that yoga is very, very good for the anxiety and depression. It will reduce the severity of anxiety and depression. Okay, and the next one is cuddling. Okay, so cuddling, hugging, kissing, and all the sexual activities, okay, will reduce stress, anxiety, and depression. We know that when compared to all the physical activities, maybe you are going to gym, maybe you are doing a lot of exercise, everything, but the sexual activity will activate all your muscles, right? So it is another way. Maybe you can cuddle with your friends, maybe you can hug your friends, and kissing, okay, you can kiss your partner. So this will reduce the stress. Maybe you are fighting for 2-3 days, but at the end of the day, just go and hug them, kiss them. This will solve all the issues. You know, many published studies says that not only men, not only human being, even animal also love cuddling. Because whenever the animal feels stress, they will cuddle. So cuddling, hugging is very, very, very essential to release the stress, anxiety, and depression. It will lower the heart rate as well as blood pressure by releasing the oxytocin and lowering the cortisol level. Okay, that's why we are promoting it. Then avoid common trigger. The trigger may be a group of people, or the trigger may be your family members, or the trigger may be your friends, or maybe some job, or maybe something else. Okay, so you have to find out which is the trigger, what is the trigger for your stress, anxiety, depression, and avoid those triggers. Okay, and the next one is being alone is a very big problem. If you are alone and you may think a lot of things, okay, you may think too much. What is it? Too much. So too much of thinking will create a lot of problem. So being alone, overthinking, unwanted fear, stressful job or assignments, inadequate planning, dumping the workloads, and over expectations. You can ask your family members to prepare only one curry at a time. If you're asking 10 curry at a time, they will be in tension. At the end of the day, they will fight with you, then you will be in tension. Right? So limit your expectation. So over expectation, lack of self-satisfaction. Whatever you're getting now, it may be a salary or it may be anything. Okay, whatever you're getting now, have a self-satisfaction. Okay, these things will solve all your stress, anxiety, and depression. Okay, so these are the main problem. So if you're avoiding all this, you will reduce your stress, anxiety, and depression. Okay, and most importantly, proper planning. The proper planning and execution of any work and limiting our expectation will reduce the stress, anxiety, and depression. Right? Okay, so coming to the take-home message, be simple, less your expectation, limit your expectation, be mindful. Whatever you do, be mindful. Do wholeheartedly. Okay, then keep hydrated, drink adequate quantity of water, be energetic, take good quality food, be energetic, be enthusiastic. Okay, always show your smiling face to others. Okay, be enthusiastic, be optimistic, and have your fun and play with your family members. Remember that age is just a number. Even I used to play with my son. Okay, age is just a number. Never mind that age will not give you anything. Okay, so fun and play with your family members, maybe your kids or maybe with others, your friends and family members. And timely completion of tasks is very, very important. Okay, have adequate rest in between your work. Then most importantly, it is your life and it is your family. So your life and your family is most important than the job. Sometimes the higher official may be giving you a lot of work to do, but you will be spending less time with your family members and you will fight with them. Okay, at the end of the day, your family only will come with you, not the building, not the institution. Okay, whatever they are giving salary, for that you are working good, but at the same time your family also important. Spend time with your family, right? And make sure that keep one thing in your mind, this is not the end, the best part is yet to come. Okay, so maybe the COVID period will be over maybe next year or maybe next to next year, but the good part is yet to come. So wait for that, we'll be welcoming on that. Okay, thank you. Do you have any questions? Okay,
yes, sir, we are having a query round, sir. Before that,
yeah, I want to show you something about university, because some people will be curious about our university. So this is International
yes,
Medical University, Malaysia.
So before that, thank you for. Yes, sir. Proceed, sir.
This is our university, International Medical University, Malaysia. So this is only one private university within the federal territory, the capital city. Okay, so International Medical University, And in the year 2018, we created a world record, the Malaysia Book of Record, followed by the record. So we created the periodic table by using the waste, the papers, okay, the cardboard boxes and waste papers. Okay, so this is some of my achievements I want to share with you.
That's very great, sir.
He's my dean and my well-wisher, Dr. Mohammad Zul. Actually, whenever we work in an organization, we need some supporting the backbone, generally we'll grow up. So he's my backbone and mentor, our dean, Dr. Zul. Okay, thank you. Thank you. That's all from my side.
Thank you, sir. Thank you for captivating us with a wonderful talk on the topic, importance of mental health during this COVID-19 pandemic and ways to achieve it naturally. Really, it was a very interesting session, sir.
Thank you, ma'am.
Which is very much essential during this pandemic situation. Especially your domain explanation on checking the anxiety, stress, and depression was a highlight of the session. We believe that we can achieve a stress-free life in this pandemic situation by following these natural therapies for managing our stress, anxiety, and depression. So truly, it was a clear and depth explanation on all the topics. Now, I would like to call upon our principal, sir, to present the e-certificate to Dr. Palanisamy, sir.
Good morning to all. Thank you, Dr. Palanisamy, sir.
Thank you, sir.
Really, it's a wonderful title. So, and much needed the title during this pandemic situation to all human community. So thank you for a wonderful title and wonderful explanation.
Thank you, sir.
Thank you for joining with us. So in future, please keep in touch. We'll do some more things. Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you.
Yes.
Yes, please proceed, Gitanjali, madam.
Yes, sir. Now, I call upon Ms. Shalini, ma'am, Associate Professor, Faculty of Pharmacy, Dr. MGR Education and Research Institute, to take over the query round. Over to you, ma'am.
Yeah, thank you, ma'am. Sir, shall we proceed with the query round, sir?
Yes, ma'am. Yes, ma'am.
Yes, sir. A question from Monisha. How to check whether a person is in depression? This is the question, sir.
Yes, ma'am. That's why I shared a questionnaire. That is a DSM. Okay, DSM-5 questionnaire. You can just type in Google DSM-5. So you can take that questionnaire. Maybe you can take printout, or maybe you can online one. You can put your score. Okay, and based on the score, in the end of the questionnaire, there is a score. Okay, whether you have mild or moderate to severe depression. Based on that, you can calculate and find out. Okay. So if you have any mild, no problem, you can follow all these steps and you can get rid of your depression, anxiety, or stress. If you have any moderate or severe form of the SAD, you can consult a doctor for appropriate treatment.
Yes. Thank you, sir. One more question from Haripriya. Sir, if anyone already has a pre-existing mental health condition, how can they protect or promote their mental well-being during this COVID-19?
That's a very good question, actually, because even though we used to say we are 100% perfect, but we are not 100% perfect, we are also having some form of mental issues. Maybe sometime without reason, we will quarrel with someone, okay, and we'll fight with our family members. So we are not 100% perfect, okay. We are also having some mental issues, So what we can do, the patient with already pre-existing mental health conditions, they can avoid what are the triggers contributing them to do that. Okay, so they have to find out a list. So these are the trigger, and these triggers contributing me to have more severe illness, the mental health illness. Okay, so thereby you have to find out that and you have to avoid that. And apart from that, you can follow all these 15 steps to avoid, to reduce your stress, anxiety, as well as depression. Okay.
Yes.
So thereby you
Thank
can
you, sir. Yes, sir. Thank you, sir. A question from Dr. Dhanlakshmi. Sir, any drugs is there to regulate and improve the mental health?
We have a lot of drugs actually to regulate the mental health, but mental health is not a single one, right? It is not a single. Mental health is comprising of social, physical, and spiritual well-being. So the mental contributes social, physical, as well as well-being. So if you have any disease, you have to consult doctor for the treatment. If you have any mental issues, you have to consult a doctor for treatment. If your physical body is good and your mental status is good, then automatically you'll be having good mental health. Okay, so for that, we don't have any single treatment, single pill to correct the mental health. Okay, so we have to go for treatment, appropriate treatment.
Thank you, sir. This is the question from myself, sir. Sir, how to improve children's mental health in this pandemic, as they are also undergoing only the online classes and we are not allowing them to go outside also? How we can improve children's mental health?
It's another good question. I'm facing the same problem. I'm staying in Malaysia alone, but my wife and boy, they are in Coimbatore. And always he complains that mummy is not allowing me to go outside, not allowing me to play with the kids, because that area is fully containment area, completely closed. No one can go inside and come out. Okay, so it's the problem. So what we are doing now, I will open the video. Maybe I'm spending, even though I have a lot of works, I will spend 1 hour through video chatting with him. Okay, both will sing song. Whatever is possible, we'll sing. Okay, whether it's a very good song or a very poor song. He used to sing something. I used to sing with him songs. I used to sing with the rhymes. And yesterday night, actually, we are reading some articles. Both are reading. Okay, so you can spend some quality time with them. Maybe you can write some stories. You can ask them to write some story, and you can play with them like a child. Okay, and maybe you can take them out. Maybe you can do some gardening. Okay, so during last 1.5 years, I developed a garden. Even none of in my unit, in my almost 5,000 units are there in this apartment. The apartment, we have 5,000 units. Whenever you see my apartment, they'll be fully covered with the green leaves. I developed a mini garden in the balcony. So I wanted to stress out all these things. I want to reduce my stress. So I developed a small garden, the balcony garden I developed. So like that, I told my son, have a garden, mini garden, water every day, morning and evening. Okay, so now we started producing some vegetables also inside the balcony garden. Okay, so we can do something, some activities, whatever possible.
So playing with them, it is like a stress buster for both, sir.
Yes,
for both the kids 100%. And parents. Yes, thank you, sir.
And notably, whether it's necessary or not, both we will make sound, loud noise. You see, the laughing therapy, we will not laugh, but we'll make noise. Who is making a very high pitch noise? I will make a noise and ask them to, hey, this sound is not enough. The decibel is not enough. You make it. Yes. So it's a kind of redirecting them to some other else, no?
Yes. Thank you, sir. One more question from Monisha. I saw a person. She always used to be in a confused mind. She never used to join with the family persons. Sometimes she is thinking of committing suicide also. How to treat this sort of patients?
Okay, so what you can do, you can create confidence. You have to find out the problem associated with the person. Okay, maybe a love failure, or maybe academic related or non-academic related. You have to find out the problem first. Okay, then take this person to a psychologist or psychiatrist. Not psychiatrist. Psychologist enough. Initial psychologist. So the psychologist will ask a lot of questions, and they will find out the reason why the patient is behaving like this. Then they will give appropriate advices. Okay, and if it is if it is mainly related to some psychotic illness, then the psychologist will forward the patient to psychiatrist. Okay, so we have to find out the root cause.
Thank you, sir. One more question from Dr. Dhanlakshmi. Sir, suggest any simple techniques to control our stress.
Yeah. No, I can do one thing, but you should not laugh it. Yes. Okay.
No, sir, no,
if you're married, okay, you try to have cuddling with your spouse. Okay, whenever, wherever possible, whether they like it or not. Okay, that's another way. That's a very good way. Whenever you are cuddling with them, it will create a good rapport. Okay, sometime maybe in the first few years of marriage, they will cuddle. Often they will touch and play, but after a few years, they will not touch and play. Okay, so that type of thing is very, very good. If you're unmarried, so what you can do, you have to control yourself. Maybe when you're in very, very stressful situation. Okay. What you can do, as I said, you can go watering some plants, or maybe you can take your vehicle, go out. Don't sit in a particular place. You can take your bike or take your vehicle, or maybe you can walk. Okay, go to the nearby shops, do something. But what I will do when I'm alone, sometimes I may feel stressful. At the time, I will go for shopping. I never think about money, I never think about anything, but I will buy whatever I want. So the shopping is another kind of reducing the stress. Right? Maybe you may thought something, I want that product, I didn't buy that product. So maybe you can think about that. You can go for a window shopping, either you want to buy something. So when I am in stress, I will spend more money. I never think about anything. Okay, it's a simple way.
Yes. Yes, sir. One more question from Syed Ismail. How to control the stress, sir? So again, the same question.
Yeah, you can follow all these 15 steps, whichever is more convenient for you, you can do it. Okay, you can spend time with your family members, maybe the friends. Now, whatever you do, be mindful that now the COVID is spreading very fast, and the latest research says that the organism floating on the air for minimum 4 hours. Okay, the latest organism, the mutant variant, floating on the air for 4 hours. So you have to be very, very careful. So with all the precautionary measures you can take, with that you can do, maybe you can, what is that? What you can do? Maybe you can go for some online classes, like music classes, maybe some coaching classes. Okay, you can do some other courses.
So thank you for clarifying all the queries, sir.
Thank you.
Yes, sir. Thank you, sir. Let us move on to the vote of thanks. Greetings to each one of you present here. Saying thank you is great manners. It is good spirituality. The roots of all goodness lie in the appreciation. On behalf of Faculty of Pharmacy, Dr. MGR Educational and Research Institute, I deem it a great honor to propose the vote of thanks and acknowledge our management for their continuous support and encouragement in conducting this 4 days international conference. I would like to express my profound gratitude to our principal, Dr. N. Harikrishnan sir, for his valuable, unstinted support and guidance. Once again, on behalf of the entire fraternity of the Institute, I would like to propose my sincere thanks to our today's speaker, Dr. Palaniswamy Sivanandi, Faculty, Department of Pharmacy Practice, School of Pharmacy, International Medical University, BJ Campus, Kuala Lumpur, Malaysia, for his interesting and thought-provoking address on the importance of mental health, which is very much essential in this pandemic situation. Once again, thank you for your informative session, sir. Thank you, sir.
Thank you, ma'am. Thank you to the organizing members as well as the management of Dr. MGR University for the opportunity. Thank you, everyone. Have a good day.
Yes, sir. Thank you, sir. Let us move on to our second session with these quotes. If you are determined to learn, no one can stop you. If you are not willing to learn, no one can help you. On behalf of Faculty of Pharmacy, Dr. MGR Educational and Research Institute, it's my pleasure to walk you through the conference, introduce our next speaker, Dr. Mahendran Shekhar, Associate Professor, Head, Department of Pharmaceutical Chemistry, Malaysia, who is present here today to share his knowledge and enhance our mental horizon. Dr. Mahendran Shekhar received his bachelor degree in pharmacy in 2004, followed by a master's degree in pharmaceutical chemistry in 2007 at JSS, and was granted a junior research fellowship from University Grants Commission of India to pursue his PhD degree in pharmaceutical sciences in the year 2008 to 2011 at JSS College of Pharmacy, Ooty, Tamil Nadu, India. He is currently working as Associate Professor, Head of Pharmaceutical Chemistry Department at University Kuala Lumpur, Royal College of Medicine, Perak, Malaysia, under the Faculty of Pharmacy and Health Sciences since 2012. He has received several prestigious awards at the national and international levels for his excellent contributions in academic and research activities. He received Anugraha Pendedict Smerlang Mara 2018 during Hari Pendedict Mara 2018. He has also received the Outstanding Researcher in Pharmaceutical Chemistry Award during the first annual Healthcare Meet 2018 organized by Venus International Foundation, Chennai, India. Sir has also received the International Achievement Award 2018 from Education Expo TV Companies Rating System, India. His innovative products won the gold medal in 3 consecutive years at the International Invention, Innovation and Technology Exhibition in the year 2017, 2018, 2019, and special awards in national and international level innovation competitions and exhibitions. 2 of his innovative products are patented in Malaysia. His innovative products secured Best Innovative Product Award in Defense, Security and Sustainability Exhibition 2017 organized by UPNM Kuala Lumpur, Malaysia, and Most Promising Invention Award in Parentis 2018 organized by Management Science University, MSU Shah Alam, Malaysia. His research is mainly in the field of drug discovery and development of drug products, natural products. He is also interested in the development of innovative natural products using green technology. He has supervised more than 25 undergraduate final year projects. He has more than 50 publications, including ISI and Scopus indexed journals, proceedings, guidelines, and book chapters. He is a reviewer with several scientific journals of international standing. We are grateful to you, sir, for accepting our invitation in your busy schedule and joining us today to be a part of this conference. Without any further delay, I would like to call our speaker to start the session. Dear participants, kindly mute your mic. We would be delighted to have your queries. Please post it in the chat box, which will be clarified at the end of the session. Kindly enjoy the session. Now I welcome Dr. Mahendran Shegar to take over the session. Please, sir.
Yeah. Good morning to everyone, and thank you very much, Madam Shalini, for the kind introduction.
Thank you,
so
sir.
Let me share my slide first. Am I audible?
Yes, sir. Yes, sir. Audible, sir. You're audible, sir.
Can you see my slide?
Yes, sir. Yes, sir. It's visible, sir.
Yeah, thank you. Thank you.
Yeah, thank you, sir.
So once again, good morning to everyone. So first of all, I would like to thank Dr. Hari Krishnan sir, the principal, Faculty of Pharmacy, Dr. MGR Educational and Research Institution, Chennai, for inviting me for this international conference on advanced research in pharmaceutical healthcare sciences. So the topic which I was chosen for my today's presentation is drug delivery of natural products in brain for neurodegenerative disorders. So first of all, why I was chosen this particular topic is because in the pharmacy program, pharmacy course, we have various disciplines like we have pharmaceutical chemistry, we have pharmaceutical analysis, we have biotechnology, we have pharmaceutics, and there are other disciplines, something like phytochemistry, pharmacognosy. So everywhere, the natural products is one of the main material that they taken for their research. So why we are taking natural product as research material? Because as we know, natural products plays a major role in the treatment of various disorders, including the brain disorders. And because natural products normally low toxic, high efficacy when compared to the synthetic drugs which are currently available in the market. So that is the reason most of the researchers, especially from the pharmacy course, normally they choose natural products as one of the main source to conduct their research, either during their postgraduate study or when they joined as an academicians. They normally choose natural product as the main source to conduct any kind of research. But there are some disadvantages. So I have been mentioned something about the advantages why we choose the natural products. There are certain disadvantages because there are so many isolated compounds and the natural products which are already reported, which are all based on the preclinical studies. Means we have been conducted a lot of in vitro and in vivo studies, and based on that we come to know the particular natural products are biologically active. But at the same time, it doesn't come to the clinical trials. So because the main reason why the natural products not much in the clinical trials, because it is facing several disadvantages, which including the physiochemical properties. So including ionization, hydrogen bonding, solubility, lipophilicity, hydrophilicity. These are all the common physiochemical properties. And also one of the main reason is the size of the natural products. Normally the size of the natural product is little bit bigger. It is in not in it is like a micro size. So that is very difficult to enter into the lipid barriers. So that is what in my presentation I have included some of the methods how you can improve the physiochemical properties and also bioavailability of natural products. And especially in my presentation, I focused mainly on neurodegenerative disorders, which including Alzheimer's, Huntington disease, and Parkinson's disease, including all the dementia-related or brain disorders. So this presentation definitely will be very helpful. Those are doing on natural product research, so that you can instead of focusing on the new compounds, you can take some of the existing compounds which are already reported for the pharmacological activities, and you can further proceed into the clinical trials instead of doing the preclinical studies. Because as we know, in research of natural products, there are so many papers has been published. So much of research has been done already, especially on the preclinical studies. So what we need to do as a researcher, we need to identify what are the disadvantages of those natural products and how we can convert into appropriate formulations to taken into the next step, that is clinical trials. So that is the main topic of main part of my presentation. So as you know, natural products means most of them might be thinking it is mainly only obtained from the plant materials. Actually, that is not true. Natural products are mainly, especially it is mainly obtained from the plant material, but at the same time, it also obtained from the some of the animal source, mineral source, even also obtained from some of the microorganisms. So that also considered as a natural products. Means whatever the drug molecule which we get it from the natural source, that is comes under natural products. So natural products have a major contribution, especially for the treatment of large amount of diseases. Any diseases, we have the solution from natural product. So many drugs that are currently available in the market, almost 40 to 50% of the drugs which are currently available in the market, in the modern drugs, most of them, that is why around 50% of the drugs, most of them either obtained from the natural products or maybe it might be derived from the natural products. Means the original source might be from the natural products. Later, the medicinal chemists normally they identify the synthetic procedure to synthesize, and they do a lot of derivatives. So those are considered as a natural derived compounds. So those are also available as in a drug form in the market. So before entering into the main topic of neurodegenerative disorders, I would like to share something about what we are doing currently in our laboratory and the basic research about the natural products. So any natural product research, normally it starts from it starts from ethnomedical data and traditional practitioners information. So the selection of plant material is mainly based on the ethnomedical data, or maybe the information that we get it from the traditional practitioners. So we need to think about, we need to see whether we are getting the reliable data or not, because you are going to spend a lot of money, you are going to spend a lot of time, but you need to be
So your voice
hello,
is not audible.
can you hear me now?
Yes, sir.
Is it okay now?
Yes, sir. But you're not.
Okay. Sorry, I think there's some internet connection problem or connectivity problem. It's okay. So once you selected the medicinal plants based on the ethnomedical data or maybe the traditional practitioner information, so we used to collect the plant material. So once collection of plant material is done, then we will move into the next step, that is authentication, because authentication is very, very important to confirm whether you have been collected the right plant material which has been mentioned in the ethnomedical data, or maybe the information which has been. Hello.
Sir,
your slides are not.
Slides visible, sir.
Share, sir, actually.
Stopped sharing the slides.
Right. Yeah. 1 second. I think some internet problem, I think. Is it okay now?
Yes, it started, sir. Started. Slides are visible now, sir.
Okay, now shall I continue?
Yes, sir, you can, sir.
Okay. Thank you. I think some connectivity problem, so maybe the sorry for the interruption. So after the collection and authentication, what we do normally, we used to remove all the unwanted like soil or maybe some of the materials which is along with the plant material that is used to be removed, and we used to keep it for drying. So once the plant material is dried, then we go for the making into a powder form to go for the extraction process. So normally when you go for the extraction process, we normally select, there are many methods are available to conduct extraction, including the cold maceration, oxalate extraction method. Those are all the old methods. And there are so many new methods also available, like supercritical fluid extraction. And you can also go for the microwave assisted extraction. So those kind of methods are recently available, and the latest methods which you can adopt for the extraction purpose to collect or to extract all the phytoconstituents which are present in the plant material. So after that, once extraction has been done, normally we go for the concentration of the extract. So concentration of the extract has been done based on by using the rotary evaporator. So we concentrate the extract by using under the controlled pressure and temperature. So once the concentration has been done, then we will take into the next step, that is isolation and purification. So normally isolation and purification has been done based on the chromatographic methods. So including the column chromatography. So now the latest method is we use flash column chromatography to isolate the phytoconstituents. So once you are done the isolation of phytoconstituents, immediately next step is the isolated compounds need to be characterized and the structure supposed to be identified. So once you are done the structural characterization based on the analytical methods, which including FTIR, proton NMR, C13 NMR, and 2D NMR techniques, and also the mass spectroscopy to confirm the final molecular weight of your isolated compound. Then we will move into the pharmacology part, or maybe we go for the in vitro studies first before moving into the pharmacology side. So when we do in vitro studies, we normally use chemical methods to determine or to evaluate certain biological activities like antioxidants, cytotoxicity, or antimicrobial. So these are all the routine activities that we do in our research laboratory. So after that, what we do, we used to select either the fractions or maybe the isolated compound or maybe the extract, which is potential enough in the biological action, especially based on the in vitro studies. We select certain compounds and we move into the pharmacology side, which is in vivo studies by using experimental animals. So these are the routine study that we conduct in the natural product research. So here, what my presentation is, so based on this kind of studies has been done already a lot, and you can find so many research articles which has been published on the extraction, isolation, and identifying the novel compounds, and they have done a lot of pharmacological studies that has been reported already. So what we need to do as a researcher, that the present condition, so we need to choose already the existing compounds or existing plant extract which has been potential enough for the pharmacological action. We need to collaborate with some medicinal chemists. So when you collaborate with the medicinal chemist, what we can do, we can isolate, we can synthesize that particular compound in large quantity, because the quantity of the isolated compounds which you obtain from the extract is very minimum quantity. So most of them that telling that the small quantity, definitely we cannot proceed with even the preclinical studies. So that how we can move into the clinical studies. So that is one of the main disadvantages of the natural product researchers. So my suggestion is, instead of searching for new or novel compounds, you can identify the compounds which are already existed and means which has been already done a lot of pharmacological studies. So you need to identify what is the disadvantages of that particular compound. Either the quantity is the difficulties, then you need to have a collaboration with our medicinal chemist to synthesize that particular compound so that it can get large quantity and you can proceed with preclinical and clinical studies. There is no issue at all. And at the same time, there are so many modern methods are available, including in silico studies. I think you might be heard about that one. And also metabolomic studies. You can identify the metabolites and toxicity studies. So this and all can be done without using any chemicals or animals. So based on the computational methods, computerized or the methods, you can determine the toxicity. You can determine how your particular the isolated compound can bind with the receptor, whether it can bind effectively with any enzymes. So those can be determined. So based on that, you can proceed to the next step, that is called clinical trials. So what is the main disadvantages? So here in my presentation, the focus is mainly on neurodegenerative disorders. So before moving into the how we can solve that the issue to deliver the natural products into the brain, so I would like to share some general disadvantages of the natural products, because the natural products are mainly large in size. That is one of the main disadvantages of the natural products. So how we can reduce the size? So you can use some of the new novel methods to reduce the size of the natural products so that can enter into the body. So these are all the disadvantages, which including in vivo instability. So normally the pharmacological activity of the isolated compounds or maybe the extract from the plant material that are not stable actually. So because of the size of the plant, size of the isolated compound means the molecular size is very high. So sometimes it might show kind of instability when you conduct the pharmacological studies like preclinical studies, and also shows low bioavailability, because the amount of drug which reaches into the systemic circulation is very, very low for the natural products. Because in any compound, as you know, the lipophilicity and hydrophilicity is very, very important. Because any compounds, if it is a hydrophilic nature, means water soluble nature, then only that can dissolve in the bloodstream. So once it is dissolved in the bloodstream, what will happen? So automatically you can get a pharmacological action. So that is the advantages of the hydrophilic drugs. If it is lipophilic nature, because any compounds, either natural product or maybe the synthetic compounds, it must be have a lipophilic enough also. not only hydrophilic. Lipophilic also very important, because in our body there are so many fat barriers are present. So once the isolated compound or maybe the natural product, if it is supposed to cross the fat barriers, it must have a lipophilic character. So lipophilicity and hydrophilicity is very, very important for any kind of natural products to get the pharmacological action, also to get the better bioavailability. Then poor solubility, that is what I mentioned, the hydrophilicity and lipophilicity, those are very important. And the poor absorption in the body. Normally in the natural products, the absorption also very poor when compared to the synthetic chemicals, because synthetic chemicals normally it is a flexible in nature, not like the natural products. Natural products, if you look at the chemical structure of natural products, that is normally rigid in structure. So it is very difficult to rotate, and it can fix with the receptor or maybe in the enzymes. So because of that reason, there might be a chances of getting poor absorption, and also problems which may occur in the target specific delivery. For example, your target is brain to deliver the natural products, but when it reaches into the systemic circulation, later from the systemic circulation to the brain, so there will be a barrier. So that way, the natural products having some of the disadvantages. Means with the amount of the natural products which enter into the brain, that is going to be very less compared to the synthetic chemicals or maybe the modern drugs which are currently available in the market. So these are all the disadvantages that we are facing currently with the natural products, and these are all the main reason that we cannot move preclinical to clinical studies. So how we can overcome this one? So nanotechnology. So nanotechnology is mainly used to convert the large particles into a nanoparticles. So that is called nanotechnology. So we are converting our the large size natural product into a smaller size, like nano size, especially the size from 1 to 100 nanometer. So that is the ideal size of nanoparticles. So normally nanotechnology is play a major role in targeting arenas, control drug delivery and drug release, and also nanotechnology play a major role to bridge the gap between physical science and the nanostructure and the biological science. So as we are a pharmacist, previously I think 10 years before and all, we haven't much focus on the nanotechnology, because nanotechnology is normal. Biological science students normally they do fractionation, then followed by they isolate the particular compound and they perform some kind of pharmacological activities. So that is what regularly our biological students, including the pharmacy students, normally they do. So now we are having the connection with biological students with physical science. Means physics, nanotechnology is more towards to physics. So we are converting our natural product into a nano size. So that will be more beneficial to treat many diseases, especially for the neurodegenerative disorders. So what are all the types of nanoparticles which are available? And you may ask question, what type of nanoparticle that we can choose? Because there are so many metals and non-metal based nanoparticles are available. So you can choose if you are interested to something like non-metallic origin. So you can choose either zinc, silica, calcium, zirconium, cesium. These are all the non-metallic origins. So you can choose this one to prepare iron oxide nanoparticles, or maybe the silicon nanoparticles. Or you can choose another type, which is metal-based nanoparticles. So metal-based nanoparticles, there are so many metals are available, and especially to convert the nanoparticles to treat certain diseases. These are all the commonly available metals and can be used to convert your natural products into nanoparticles, including you can use platinum, copper. Copper means you can use copper precursor like copper sulfate, copper acetate. So these are all the chemicals that you can use it to convert your natural product into a nanoparticles. You can also use palladium, nickel, cobalt, then silver, gold nanoparticles. So every individual metals, there might be some advantages, and at the same time, there are some disadvantages as well. Because if you look at some of the metals are very expensive, like if you want to prepare a gold nanoparticles that are very effective, But at the same time, to prepare a gold nanoparticles, you need to spend a lot of money, means very expensive metal, which you need to use it to convert your natural product into a nanoparticle. So finally, when the product comes into the market, the price of that particular drug may be very expensive. So instead of that one, you can use some of the metals which are very cheap and also having a lot of advantages, which including you can use silver nanoparticles, like you can use silver nitrate, you can use copper sulfate or copper acetate can be used. These are very easily available chemical which can be used to convert your nanoparticles, convert your natural products into a nanoparticles one. So now only I come to the real topic of my presentation. So here we are going to discuss about how the drug delivery of natural products in brain for neurodegenerative disorders. So far what I have been mentioned, that are all the general methods which can be adopted to convert your natural product into a nanoparticles. So as you know, neurodegenerative disorders which primarily affect the neurons in the central nervous system. So the gradual loss of neurons, which indicating the person is affected by neurodegenerative disorders, so which affect the brain functions. So that is the neurodegenerative disease, which including it affects your memory, it affects your movement, it affects also your cognitive function. So these are all the disadvantages or maybe the problem when the gradual loss of neurons in the central nervous system. So here in our laboratory, what we are doing currently, we are focusing on neurodegenerative disorders, especially on Alzheimer's disease, Huntington disease, Parkinson's, and myotrophical lateral sclerosis. So here, as you know, the latest report said that every 3 seconds all over the world, every 3 seconds, at least one person is affected by any neurological disorders, which including dementia. Even the previous presenter, Dr. Palaniswamy, I think he mentioned about all the mental disorders. So that also included with the neurodegenerative disorders, because that affect our memory, movement, and also the cognitive functions. So every 3 seconds, one person is affected because of any of these neurological problems. So we need to have a solution to solve these neurodegenerative disorders, or maybe the dementia, or maybe the mental disorders which we are facing even currently. Because of COVID-19, we are facing a lot of mental illness. So that can be avoided even if you take the natural products. So you have the solution in natural products. So as I mentioned, there are so much of studies has been done already, and so many phytoconstants which are already reported to treat for neurodegenerative disorders, which including flavonoid polyphenols, so flavones, flavonols, which including quercetin, amphetamine, digoxin, naringenin, cyanidin. So these are all commonly available and mainly obtained from the fruits and vegetables, especially all the citrus fruit, which is containing all these flavonoid polyphenols. And also naringenin, even you can get it from the mainly obtained from the grapes. Okay. So it is not necessary that you need to find these kind of fruits or plant material to go to forest or jungle to find this one and to isolate this particular compound. So what as a researcher you can do is, you can isolate, this already has been reported. It is not necessary that you have to conduct a research on isolation, characterization, then followed by you need to do all the basic in vitro and in vivo. These are very well established compounds. So the present research is what you can do, you can isolate this particular compound. You need to identify what is the disadvantages of this particular compound are facing. Because this is already well known for the neurodegenerative disorders, treatment for the neurodegenerative disorders. Why we cannot bring these compounds into the clinical trials? What is the disadvantages? So once you identified that one, so the current research you can focus on, you can modifying the chemical structure to improve the bioavailability, to improve the solubility, or you can convert these compounds into nanoparticles. Okay, so that you can improve the bioavailability, you can improve the onset of action, you can improve the efficacy, you can reduce the toxicity. So there are so many advantages when you convert this particular compound into a different kind of derivatives. So similarly, as you know, curcumin Curcumin, even if you see every year, you can see thousands and thousands of articles are published in curcumin. They have done a lot of studies. Even still, there are so many studies are going on, including resveratrol, lycopene from tomato. There are lots of studies has been done. But still, we are looking for a new compound. Why we are looking for a new compound? Because the existing compound already reported that is potential enough. So now, immediately what we need to do, instead of focusing on how to solve this problem, which these compounds are facing, we are identifying the new compounds. That is what the mistake the currently doing by the natural product researchers. So don't search for a new compound, don't search for something new plant to isolate or characterize or do the extraction and everything. So instead of that one, you find a isolated compound and you check what are all the activities that has been done and why that compound is not in the clinical trials. What is the reason? What is the problem that the particular compound is facing? So how you can solve those problems so that research will be more ideal and more beneficial, because once you solve the problem which these isolated compounds are facing, so automatically this can be moves into the clinical trial stage. So once it is moves into the clinical trial stage, so automatically we can see these kind of compounds in the market to treat a certain kind of diseases, including the neurodegenerative disorders. Similarly, some of the phenolic acids, which are mainly obtained, these are all mainly obtained from the commonly available fruits and vegetables. Even some of the spices materials, you can also isolate these phytoconstituents, which including gallic acid, vanillic acid, caffeic acid. These are very common. But when you look at these compounds in the market, you cannot see, because they done research, they done publication, and they mentioned that these are highly potential to treat this disease, that disease. But finally, what is the outcome? So to bring these compounds into the market, you need to identify the disadvantages. You need to identify what is the problem that these compounds are facing. Similarly, berberine, morphine, some of the compounds I think you can see in the market, morphine and all is available. So galantamine. So these are some of the examples of alkaloids from the natural products. Even some are available in the market as well. Similarly, piperine, nicotine, caffeine. So these all commonly obtained from the very common and what we are currently using in our daily life. So these compounds are available actually. So as I mentioned, we are done so much of studies, preclinical studies, like including in vitro studies and in vivo studies, and we have been reported that has been used for the neurodegenerative treatment for the neurodegenerative disorders. But however, the translation of these the compounds which I have been mentioned in up to the previous slide, so that is not taken into the clinical applications, because that is very challenging, because all the natural products are facing certain problems, which including low bioavailability, limited solubility, physiochemical instability, which including the hydrogen bonding, ionization, and other physical properties, and rapid metabolism. Some of the natural compounds or the natural products are rapid in metabolism. So after the distribution, the final step is excretion, but certain natural products, very fast excretion, means the rapid metabolism, so that there is no the pharmacological action will not be there. So that these are all the disadvantages. And another one of the main problem that we are facing, especially for the neurodegenerative disorders, the natural products which cannot cross the blood-brain barrier. So that is one of the main disadvantages why we cannot bring those natural products into the market, or especially to the clinical trials. So now in my presentation, I included several methods how you can convert your natural product into a nanoparticles. So the nanoparticles or maybe the nano carrier, which can carry your natural products. So that will carry your natural products and improve the therapeutic response, and also increase the pharmacological action as well. Means the efficacy also will be increased when you convert into a nanoparticles, because the advantages of nanoparticles, which can enter easily into the any part of the body when compared to the normal particle size or the normal size of the natural products. There are 7 or 8 methods which you can when you want to convert into a natural product into a nanoparticle. Hello, can you hear me? Hello.
Yes, sir. Yes, sir. Yes, sir.
Yeah. Sorry. Yeah, I thought some internet connection problem. Okay.
No, sir.
So, so normally I'm going to tell about 7 important methods which you can adopt to convert your natural products into a nanoparticles, means which can carry your the natural product as a carrier. So that is what I'm going to mention. So the first one is carbon nanotube, so which is made up of carbon with a diameter typically in a nano size. So the surface modification or functionalization with the hydrophilic molecules. So hydrophilic molecules, as you know, it is a lipid soluble molecule, and polymers or other biocompatible molecules can enhance carbon nanotube water dispersibility. And also when you convert this into your nanoparticles into a carbon nanotube carrier, so this automatically reduces the toxicity effect also, and also improve the delivery to the tissues and also cells which are present in our body. So that is the major advantages when you convert into a carbon nanotubes. So one of the very important type of carbon nanotube is functionalized multi-walled carbon nanotubes, which is mainly used to cross and intact with the blood-brain barrier. So because here my focus is on, and we are doing currently research on neurodegenerative disorders. So our focus, we need to convert the nanoparticles which can cross the blood-brain barrier. So how we can convert a carbon nanotube? From that carbon nanotube, we can go for this one, functionalized multi-walled carbon nanotubes, which can easily cross the blood-brain barrier, so that the amount of drug or the natural product which enter into the brain will be high amount. So once it enter into the brain, automatically there will be a pharmacological action. So that is the advantages of this kind of method. And the second one, you can also choose liposomes. I think liposomes, you need to choose at least one lipid bilayer. Maybe you can use phospholipids to convert your natural product into liposomes. So including phosphatidylcholine choline and also obtained from the egg phosphatidyl ethanolamine. So these are all the phospholipids that you can use it to convert into liposomes. And this can provide an excellent therapeutic tool for treatment of neurodegenerative disorders, because once you convert into a liposome, so that can easily enter into the brain, which can cross the blood-brain barrier, and it is easily enter into the brain. So automatically the amount of drug which enter into the brain is very high, and you can get the beneficial effect in the central nervous system. So that is the advantages of this method. And this is one of the very important method, the third one, polymeric nanoparticles. So here you can use either synthetic polymers or maybe the natural polymers, which can be used to convert your natural product into a polymeric nanoparticles, which including polysaccharides, or maybe you can use polyesters, polylactic glycolic acid. So these are all the nanocarriers which you can use it to convert your nanoparticle, convert your natural product into a polymeric nanoparticles. So these are more stable and when compared to other methods. So this is having some advantages when compared to other methods. Why? Because any nanoparticles, there will be some disadvantages as well, because the size of the nanoparticle is very important, the shape and charges and surface morphology. So this is not stable when you use other methods. But when you use polymeric nanoparticles, so whatever the size that you get it is a standard size. All the nanoparticles are in the same size and shape. So that will be more beneficial when compared to the other methods. And this method also facilitates the delivery of a range of different cargoes with high capacities, and can be engineered with different drug release mechanisms and modified with various targeting ligands. So this is also one of the advantages of converting the polymeric nanoparticles. And the fourth one is lipid nanoparticles. So here in the lipid nanoparticles, normally we use the lipophilic compounds to carry the natural products. So it is a bioacceptable and biodegradable nature of lipid nanoparticles, which makes them less toxic when compared to the other methods, and which is mainly suited for the brain targeting because it is lipophilic nature. So if your the nanoparticles is highly in lipophilic nature, so automatically which can easily cross the fat barriers which is present in our body and especially the brain. So blood-brain barrier which is easily can cross because you are converted your natural product into lipophilic nature. So you can also make a lipid-based formulations which can be designated as the current and future generation of drug delivery system to cross or to bypass blood-brain barrier and reach the target size due to the small size, because it is a very small size, so which can easily enter into the barriers, fat barriers which is present in our body, especially the dots, the reticular which is present in our endothelial system. And another important method is micelle. So micelle also, it is an aggregate of surfactant molecules actually, which can disperse the liquid forming a colloidal suspension. So here your the natural products which can be converted into a colloidal suspension form or maybe in the liquid form, which is having hydrophilic head and which is having, this is considered as a tail form. This is hydrophobic. So this is in hydrophobic form and the outside layer which is in the hydrophilic nature. So you can use any type of natural product, whether it is a hydrophilic nature or lipophilic nature. You can adopt with this method, which is an very useful method to deliver your natural, the isolated natural compound or maybe the plant extract to the particular site in our body. So these micelles could be used even effectively for the encapsulation of drugs that are usually hydrophobic in nature. And also you can use some of the compound which is in hydrophilic nature also can be adapted by this method. So the pathways which we can which followed for this drug delivery method to brain are multiple, which including paracellular and transcellular. Because what are the methods, other methods that we have seen, some of the methods are towards to paracellular. But this one, this micelle is having advantages, especially when you treat for the neurodegenerative disorders. So this can act as both paracellular and transcellular. So that is the advantages of this method. So that is what I mentioned, each and every method having some advantages, some disadvantages as well. And also you can convert your natural product into a nano capsule as well. So which can be produced in a fast manner. So other methods, you need some expensive chemicals to convert into a nano carrier. But this one is a solvent-free method. It's a green technology method, which you can adopt, which you can convert your natural product into a nano capsule. So here the nano capsule, the shell is made up of with some non-toxic polymers. So it is like something like a normal capsule. So this kind of capsule, the shell is made up of some non-toxic polymers, so which won't produce any kind of toxic effect later on. So moreover, the lipid nanoparticle nanocapsule surface modification can further improve their bioavailability. So because of that one, the bioavailability is automatically increased. So the amount of drug which reaches into the systemic circulation will be very high. And also the amount of drug which reaches into the central nervous system also very high when compared to when you convert your natural product into a nanocapsule. And another very important method is dendrimers. So this is also one of the recent technology which we use it to convert the natural product into nanoparticles. So here also whatever the size of nanoparticle is in uniform form and also easy of multi-functionalization and available internal cavities. This can transport diverse therapeutic agents. So any type of natural products like hydrophilic nature or maybe the lipophilic nature. So any type of compounds can be, even high molecular weight compounds can be converted into a dendrimers, which can carry those molecules, which can use it for the diverse therapeutic agents and the peptides and genes. Anything can be used in this particular dendrimers method. So which can demonize the cytotoxicity, means it is toxic free because you have been used the toxic free materials, and also at the same time which will improve the pharmacological activity, means improve the efficacy of the particular natural product or the isolated compounds. And another last very important method which you can adopt also to convert your natural product is nanogel. So this is something like a kind of normal formulation, like you can convert your natural product into a hydrogel, which is water soluble gel. So nano particle which can be converted into like that, and this can cross the hydrophobic polymer network. So this is the advantages of when you convert your natural product into a nano gels. So which is more highly bioactive when compared to the original molecule. So actually we have done a kind of comparison studies also. What is the effectiveness of the normal natural product? Once it is converted into a natural product, what is the advantages? Either it is improving the pharmacological action or reducing the toxicity effect, something like that. So here, this nanogel is also very easy to deliver the natural product into the blood-brain barrier, means which can easily cross the blood-brain barrier. So this is having more advantages to convert your natural product, especially to treat any kind of central nervous system related disorders, because this can easily cross the blood-brain barrier. So let us see what are the advantages. So normally when you convert into nanoparticles, which can enhance the neuroprotection activity and increase the bioavailability, means which will increase the amount of drug which enter into the systemic circulation, and also improve the pharmacokinetic properties. As you know, the pharmacokinetic properties, which including absorption, metabolism, ADME properties, distribution, metabolism, and excretion. So that properties will be increased when you convert into a nanoparticles, and also increase uptake and concentration in brain. So normally, once it crosses the blood-brain barrier, so automatically the intake of the particular natural compound enter into the brain is very high amount. So the concentration of the particular natural compound present in the brain will be very high. And also enhance reverse memory and learning impairment. Memory impairment also is one of the neurodegenerative disorders which can impair the memories, learning and impairment. Is a major role because sometimes because of the route of administration, the amount of drug which reaches into the particular site of action may be reduced. So you need to choose the particular route of administration which is more feasible, especially for the brain disorders. So you can choose so many method of route of administration like intravenous, intranasal delivery, and intracerebral. This is intracerebral delivery, and intrathecal and intraventricular. Intraperitoneal route also has been used to deliver the drugs for neurodegenerative disorders, and transcranial route. Even some drugs which are available for oral administration and ocular administration also has been used. And among this method or route of administration, we found that one of the very significant method, which is intranasal method. So that is what we are currently doing in our research laboratory. So that is nose to brain delivery. So normal drug delivery, the difference between the normal drug delivery and nose to brain delivery is, so in the normal drug delivery, when the drugs are converted into maybe natural products or maybe the modern drugs, once it is administered, what will happen? So that will reaches into the systemic circulation. Then it reaches, then later it will go to the site of action, which is blood, which is supposed to cross the blood-brain barrier. But due to the disadvantages or the physiochemical properties, that cannot be cross the blood-brain barrier. That is the disadvantages of the routine route of administration. But the advantages of the nose to brain delivery is, it is not going to systemic circulation. It is directly reaches into the brain through olfactory nerves. So here, once you converted into nanoparticles or maybe the nanogel or hydrogel, so which can be formulated to nose to brain delivery formulation. And once it is applied to the nose, that enter into the brain through olfactory nerves by crossing the olfactory bulb. So there is no systemic circulation is involved here. So whatever the drug amount which is entered into the nose, that directly reaches into the brain. So the onset of action also very fast. You can get a fast onset of action. It will be very fast. The bioavailability will be very high. The amount of drug which reaches into the brain also very high. So there are a lot of advantages when you use this kind of nose to brain delivery method. So when you use this nose to brain delivery, you can reduce the dose amount, because normally if you take oral dose or any other route of administration, oral or any other route of administration, the amount of drug which is used is very high, because once it reaches into the systemic circulation, then finally it moves to the blood-brain barrier, across the blood-brain barrier, and finally when it reaches into the brain, very small amount of drug which reaches into the brain. So to avoid that reason, if you use the nose to brain delivery method, so the amount of drug which is used is very less. So once the amount of drug is very less, but at the same time, the amount which reaches into the brain is very high. So whatever the amount we use and the administration, the same amount without any loss that will enter into the brain. So that automatically the pharmacological action will be potential when compared to the normal route of administration. So this also minimizes the toxicity when compared to other method of route of administration, and this also avoid first pass metabolism, and also this will directly enter into the brain. So brain the main our main aim is to release the drug into the brain. So that will be achieved when you use this method, and the bioavailability also very high when you use nose to brain delivery, and the stability also very high. At the same time, which can enhance the solubility, because the nose to brain delivery, which can directly enter through the olfactory nerves and reaches into the brain, so the solubility will be enhanced because you are converting into the nanogel, which can be easily dissolved in the particular the place which is present in our nose. And so it is also site specific and systemic delivery, because your specific site is brain. So your aim is your natural product or maybe the any type of drugs which is supposed to be enter into the body. That is your aim. So when you choose this method, it directly take your natural product or maybe the drug molecule into the brain. So that way it is site specific and also systemic delivery, and also fast onset of action. So the pharmacological action will be very fast when compared to other route of administration. So these are all the advantages when you convert into a nanoparticle. So instead of doing the routine research like how we do extraction, isolation, and doing the pharmacological studies, so my advice to the young researchers especially, and also to the faculty members, we can adopt this kind of techniques. So here my focus is on neurodegenerative disorders. So it is not like these nanoparticles only can be used for the neurodegenerative. It is not like that. You can convert this kind of nanoparticles, and this can be used to treat any kind of diseases, including cardiovascular disease. You can use these nanoparticles to treat diabetes. You can use, and even there are many drugs which are currently in the clinical trials, so which are mainly made up of natural product based nanoparticles to treat cancers, because cancers so far there is no appropriate treatment is available or appropriate drug is available. So now there are certain natural products which are converted into nanoparticles, and currently it is in the clinical trials, and hopefully we can see many drugs which is mainly based on the nanoparticle preparation in near future. So the promising results from the delivery of natural products across the blood-brain barrier using nano-sized carriers may be one of the best choice. So my choice and my suggestion, those are doing research on natural products, you can use this kind of method, or you can adopt these methods so that you can come up with the molecule which can be allowed into the next stage, which is clinical trial stage. Okay. And most of the natural product, the main problem is bioavailability. So to improve the bioavailability, only thing is you need to convert into nanoparticles. Any methods you can choose. All the methods having some advantages. So you need to choose according to the what is that? The natural product which you choose it. So according to that, which method may be suitable, whether it is a hydrophilic nature or maybe the lipophilic nature. So accordingly, you can choose the method. And you can choose the nano carrier, like what I have been mentioned, like a carbon nanotube. You can use dendrimas. You can use other like lipid nanoparticles, something like that. So when you convert into a small size, this picture is indicating that One, it is a smaller size that can easily cross the blood-brain barrier. This something like a fat barrier easily cross the brain barrier, fat barriers. But if you are not converting into nanoparticles, the size of the natural product is very high. So what will happen? So that will not enter into the that will not cross the fat barriers, and that won't allow to enter into the site of action. And especially for the neurodegenerative disorder, as I mentioned, a drug molecule or maybe the natural product, our aim is supposed to reach into the brain. So that will be stopped actually if it is a bigger size molecule. So my recommendation is normally our researchers and also the institutions which we belongs to working. So normally they spend a lot of money, especially for research. They given a lot of fund to conduct research, and even many funding agencies, they are very much interested to give the fund, especially those are doing for the natural products. But whether we are utilizing properly or not, that is a very important thing. So what we need to do when you prepare a new proposal, especially for natural products, don't search for a new compound, don't search for new plants to conduct our research. So instead of that one, you take the existing compounds which are already very well established. You find what is the disadvantages, why that particular compound is stopped in the preclinical stage, why that is not moves into the clinical trials. Once you identify what is the problem, so automatically you can design your research project or maybe the research proposal. So that way you can convince the funder also. So automatically you can easily get the fund from the funding agencies, because you are going to establish the compound which maybe can be moves into the clinical trial stage, and later that can be comes into the market as well. So that is the advantages. So use nanotechnology and nano carrier based approaches. So in the drug delivery of natural products, which may help and improve the especially the neuroprotective effect and increase the bioavailability as well. So with that, I would like to thank everyone, especially the organizer, Dr. MGR Medical Education and Research Institute, for giving me an opportunity. And thank you very much to everyone for listening my presentation. So this is my email ID and handphone number. So you can contact me at any time if you have any doubt, or if you want to have a collaboration, especially related to the nanoparticle related research. So, and also if you are interested more on innovative products or maybe the natural products, you can feel free to contact at any time, so that we can, we need to work collaboratively. That is what we are doing now. Because previously the pharmacy students or maybe the pharmacy faculty, they work within their faculty. So that is the reason we are not much aware of the nanoparticles are converting into a nano carrier or something like that. So when you have a collaboration with something like the engineering faculty, those are very familiar for this kind of nano carriers. So we can adopt their techniques into this one for the biological science. So that when you engineering and the biological science work together, definitely we can bring so many compounds, so many drug molecules to treat many diseases, even including the anti-cancer. Now, I think many drug molecules which are currently available in the clinical trials because of the conversion into nanoparticles, so that automatically the bioavailability will be increased, the onset of action will be increased. Now, whatever the disadvantages like lipophilicity and hydrophilicity, as you know, any molecule to be a drug-like molecule, it's including the molecular weight, the partition coefficient, which including bonds. So as per the Lipinski rule of the natural product, the isolated compound, whether that will be a drug-like properties or not. So once you identify that is having the drug-like properties, easily you can adopt and you can convert into a nanoparticles, or you can use the nano carrier to carry your natural product to deliver into the particular site which you have been planned. So in this, maybe I have been more focused on neurodegenerative disorders, but you can adopt all these techniques to convert a natural product into nanoparticles can be used for the many used for the treatment of many other disorders. As I mentioned, you can use it for any kind of disorders, including the cancer disease. So with that, thank you very much once again, and maybe I will leave it to the organizer for Q&A.
Yes, sir.
Yeah,
thank you, sir. That was really an outstanding presentation on drug delivery of natural products in brain for neurodegenerative diseases. For sure, we have gained an amazing knowledge on nanoparticles by a clear explanation, sir. Definitely, we would like to take your recommendations for our betterment. Thank you once again, sir. Now,
yeah, thank you. Thank
I
you
would
very
like to, yes, sir. Now, I would like to call our principal, sir, to present the e-certificate to Dr. Mahendran Segal, sir.
Thank you, Dr. Mahendran. So it was an excellent speech and a very useful title you've given to us. So thank you very much joining with us. Thank you. So please present.
Yeah,
Once
thank
again,
you
on
very
behalf
much.
of my management and on behalf of faculties. So thank you very much, sir. Thank you very much.
Thank you, sir. So with your permission, there are some questions in the chat box, sir. Shall we move on to the query round, sir?
Yeah, sure, can.
Okay, sir. So the first question is from Nanda. Does drug delivery in natural products to derivative products are more effective in neurodegenerative activity? Sir, am I clear, sir?
Yeah. Now, can you repeat your question?
Yes, sir. Does drug delivery in natural products to derivative products are more effective in neurodegenerative activity?
Yes, of course, because instead of doing the activity is with phytoconstituent, instead of doing the extraction, if you do it with the isolated compound or maybe the natural product derived compounds, means if you modify the chemical structure into a new form, so that you will get a new compound, that is natural products derived compounds. So that will be more beneficial actually. So when you use it for the treatment of neurodegenerative disorders. So when you conduct the pharmacological studies also, there are so many studies has been proven already. So when compared to the normal natural compound and hello, yeah, if you convert into nanoparticles, so that will be having the potential pharmacological action. So that has been proven already with so many studies actually. So definitely you can adopt this technique to deliver the natural product, or maybe the means isolated compound, or maybe the derived compounds to deliver into the brain.
Okay, sir. Thank you, sir. Next question also from the same person. Natural drug has many pharmaceutical activity in one species, but any specific neurodegenerative drug activity possible?
Especially that also that is why I mentioned so many compounds. So what are the compounds that even, for example, if you take curcumin has been reported so long, almost 10 years or 15 years, they are reported for even for many neurodegenerative disorders, including Alzheimer's disease, Parkinson's and everything. But we cannot bring that into a market as a drug form to treat neurodegenerative disorders. So that is what I'm telling. We need to convert into a means nano carrier. There are so many, plenty of compounds are available, which I mentioned, lycopene, curcumin, mangiferine. There are so many other naturally isolated compounds also, including resveratrol, naringenin. So these are all the very well-known compounds used for the treatment of neurodegenerative disorders. So preclinically, everything is proven. So now our aim is how we can take those molecules into the clinical stage, clinical trials. And one more advantages of those compounds which I have been mentioned in my slide is, so all the compounds are obtained from the edible fruits and plant materials. Means most of the compounds are obtained from the fruits, the commonly consumable fruits and vegetables. So it is very easy for us to bring those kind of molecule into the clinical trial stage, because that is already consumed in the form of vegetables and fruits. So that way, there are plenty of compounds are available. You can choose, and if you do literature review, I think you can get plenty of examples.
Okay, thank you, sir.
Yeah, I think.
Yes, sir. Next question. Does nanoparticles have any neurospecific activity?
Yeah, neurospecific, especially for the memory impairment, which can be used for the treatment of memory impairment or to improve the cognitive this one. Because currently, that is why I mentioned, actually there is no natural products are available in a drug form to treat something like Alzheimer's or Huntington's or maybe the Parkinson disease. So when you consume this kind of fruits which is containing all these natural products, so that can improve your memory, and that can improve your cognitive progression. So that is the advantages of these natural products.
Okay, sir.
Yeah,
so next question from Dr. Dhanlashmi ma'am. Which metal is very suitable for herbal nano formulation?
Metals, if you want to choose normal metals like copper oxide nanoparticles are very famous nowadays, which is green technology method. You can also adopt for silver and gold nanoparticles to convert into nanoparticles, your natural product into nanoparticles. But apart from that, once you converted into nanoparticles, the nano carrier, which I mentioned, the 7 methods, right? So from that, liposomes, that is one of the highly used methods and having lot of advantages when compared to other methods. So my suggestion is to go for liposomes, or maybe you can use micelle. So these two methods are currently used by many researchers, and they have been reported that which is having more advantages when compared to other methods. So you can go for these two methods, especially if you're working on neurodegenerative disorders, you can choose this one.
Okay, sir. Next question from Mrs. Shalini ma'am. Which metal containing herbal formulation is most commonly used currently in neurodegenerative disorders?
That is why there is no nano formulations are currently available in the market. So currently still the research is going on, and the nanogels are available actually, nanogels and nano capsule. So that can be very useful actually, especially for the neurodegenerative. So the hydrogels. So that is one of the main formulations we have been adopted for a long time actually. So the same method we can use it to convert into a nanogel. And once you convert it into a nanogel, you can go for the nose to brain delivery. So just you need to apply through nose directly. So that will reaches into the brain through olfactory nerves. So instead of you prepare a formulation, something like a tablet or capsule or any other form like liquid dosage form. So instead of that one, you go for a nose to brain delivery dosage form. Like you can prepare a nanogel or hydrogel, which can easily dissolve into the olfactory nerves. So directly it reaches into the brain. So that is the advantages of the route of administration I mentioned in my presentation also. So if your focus is on neurodegenerative, focus on nanoparticles. After that, immediately you go for the nose to brain delivery formulations instead of going for other formulations. So that is having more advantages.
Next question, sir, from Adira. Yeah. What is the main purpose of using nanotechnology for drug delivery, and how do we test neurodegenerative disorders?
Yeah, that is so many advantages actually. So even currently available synthetic molecules also, that preclinically proven a lot actually. They have done a lot of studies, they have done so many things. Even if you select a new medicinal plant or maybe the natural product to study for neurodegenerative disorders, you will give a final report that this compound or maybe this extract is potential for treat this kind of disorder like Alzheimer's and Parkinson's. That is very common. Research has been done by many researchers, and currently what we are doing and reporting. So that is a preclinical stage. So why we cannot bring those preclinical to clinical? So when you convert into nanoparticles, you can bring it, because bioavailability is one of the main factor why we cannot bring the natural product into the real life actually. So, and also the onset of action will be increased when you when you convert into nanoparticles, and also the solubility is increased, and also you can improve the drug metabolism, including even also the drug absorption also can be increased. So there are quite a lot of advantages actually. So whatever the disadvantages that you are facing in our the natural products, almost 100% you can solve if you convert into nanoparticles. So that is my suggestion. Doing future research, especially on the natural products, we can plan accordingly so that this will be having in future. Actually, there are many drugs that maybe we can get it in the market, especially in the nano form. So if your focus is on that way, so definitely you can bring some natural products into the market. So our main aim is, because why we are doing research on natural products, our main aim is not just publication or just we conduct some kind of research and just for getting degree. We have to move from the other way. So why we do research? After research, it's supposed to be useful to the public, right? So that is our main aim actually. So whatever you report, finally it is supposed to reach us to the public, then only that is considered as a real research actually. So whatever the current researchers, what we are doing is just we do research, we do publication, we get degree, that's all. So instead of that one, you go to the next step, identify. So if you identify how to solve those problems, so once you find a solution, so automatically that reaches into the next level. So definitely one day, maybe not today or tomorrow, or maybe after 1 year, after a few years, definitely you can see that particular compound into the market, because that is having more advantages, because your report will be very valuable actually. So that will be taken consideration by the industry people or maybe the other researchers, so that they can go to the next step. Instead of doing the groundwork, my suggestion is go to the existing one. You identify what is the problem, and based on that you can proceed. So if you still you are doing the groundwork, like something like you want to find a new molecule like that. So all the time the research will not move to the next stage actually. So everyone, even 10-15 years before what we have been done, currently the same thing that the current generation also doing. So that way we need to move forward actually. Why the 10 years before whatever the research has been done, why it is not been into the market? So such a way we need to plan. So I think that this is what my suggestion want to give for that the question actually.
Yes, sir. 2 more questions, sir. So
Yeah.
next question is again from Shalini, ma'am. Is there any single herbal drug effective against neurodegenerative disorder?
I think she might be asking about currently available in the market.
Any single drug?
No, actually there is no particular drug, especially for the neurodegenerative disorders, which including Alzheimer's or Parkinson's. There is no drugs are currently available like that. So in the form of supplement, it is available, like mangiferin, curcumin. These are all the compounds are available in the supplement form, which can be taken to improve your memory. So it is not directly particularly written that this particular compound has been used for the treatment of particular disease. So they mentioned in general. So if you want to improve your memory or cognitive level, so automatically if you take this kind of supplements, like natural product supplements, which is containing all these ingredients, so that will be more beneficial. But if you ask particular drug, I think no, so far no. Yeah, I think any more questions? Yeah.
No, sir. Thank you, sir. That's all, sir. Thank you for spending your valuable time in answering all our queries, sir. Thank you so much, sir.
Yeah, thank you.
So now it's time to thank everyone. On behalf of Faculty of Pharmacy, I take this opportunity to thank those who have directly and indirectly contributed to this program. First and foremost, I thank our management, principal sir, and the event coordinators for your constant support and motivation in organizing this program. I also extend my sincere thanks to the speaker of the above session, Dr. Mahendra Shekhar sir, Associate Professor, Faculty of Pharmacy and Health Science, University Kuala Lumpur, Malaysia, for enlightening us on the topic drug delivery of natural products in brain for neurodegenerative disorders. We are pleased to have your participation in this ICAP 2021, sir, and we thank you for your valuable contribution, sir. Thank you once again to the speakers for making this program more meaningful and interesting. The participants are requested to stay back for the valedictory function, which will be addressed by Dr. N. Harikrishnan, Principal, Faculty of Pharmacy, Dr. MJR and Educational and Research Institute, followed by a guest lecture by our chief guest, Dr. J. Jayasilan, sir, Chairman, IPA Industry Division, President, Tamil Nadu Pharmacy Council. For the kind attention of the participants, the feedback link for the e-certificate will be posted in the chat box during the valedictory program. Thank you all. Kindly stay back for the next program. Thank you all.
Komal sir is going to join. Please find out.
Sure, sir. Sure. Yes, sir. Yes, sir. Sir has joined, sir.
Good afternoon, sir. Sir, good afternoon, sir.
Hello.
Sir, good afternoon, sir. Voice cake, sir.
Dr. Good. Voice cake. Dr. Hari, good afternoon. Good afternoon to everyone. Yes.
Thanks.
I am ready now. Yeah.
Okay, sir. So, Komal.
Sir, with your permission, shall we move on, sir?
Please.
Yes. A warm good afternoon to the galaxy of intellectuals, invited guests, professors, students, and participants to the valedictory program of ICAP 2021. It's a matter of immense pride and pleasure to be a part of ICAP, and we thank you all for making this 4-day international program a grand success. On behalf of the institution, we are delighted to offer a gracious welcome to you all. Talent and skills are the crops that are nurtured, groomed, and given all possible opportunities to grow and bloom. A motivator, a source of belief, support, and encouragement, who is none other than our beloved principal, Dr. N. Harikrishnan, sir. May I now request our beloved principal to deliver the welcome address and give us a brief summary of the 4-day event. Over to you, sir.
Thank you, Komal. Thank you. So, good afternoon, all. So, respected faculties and distinguished guests, the faculty members, students, and participants from other colleges, good afternoon. So, it's a moment of great privilege and honor for me to extend a hearty welcome to all of you. Today, as we are valedictory function, the International Conference on Advanced Research in Pharmaceutical Health Sciences. At outset, I would like to thank Pharmacy Council of India and the Indian Pharmaceutical Association, Tamil Nadu State Branch, who heartedly accept this event. With their extended support, this event has transformed to its magnificent scale. So I extend my management people, thank our management people, and extend my warm welcome to our respected Dr. Jayasilan, sir. So Chairman, IDMA, and IPA Industry Division, President, Tamil Nadu State Pharmacy Council. So it's my pleasure to welcome all members from Indian Pharmaceutical Association for their support and participation in this international conference. So this is fourth day. The first day it started from chief guest, Professor Dr. Shailendra Sharaf, Vice President from Pharmacy Council of India. So he given a talk about the technology used in the pharmaceutical industry. So next speaker, Dr. Sherin from Department of Cardiovascular Medicine, University of Madras Medical School from USA, and followed by Dr. Muthukumar Krishnamurthy, a research fellow at Austin University, and Balram Kumar, assistant professor, School of Pharmacy from Ethiopia. And the topic is the food and degradation studies. So final day, the validation function is going to happen under the benevolence of Dr. Jayasilan sir, ICA. So thank you very much, sir. Thank you very much. So please, Komal, please.
Yes, sir. Thank you, sir. Nothing great will be achieved without great men, and men are only great if they are determined to do so. We are happy to have with us Shri Jayasilan sir, Chairman IPA Industry Division, Chairman IDMA, President Tamil Nadu Pharmacy Council, as the chief guest of today's program. May I kindly request Mrs. Gajalakshmi ma'am to share a few words of introduction about our chief guest. Over to you, ma'am.
Thank you, Mrs. Komal ma'am. Greetings for the day. I would like to register beautiful quotes prior to our chief guest introduction. Success is not always about greatness. It is about consistency. Consistent hard work leads to success. Greatness will come. I'm very delighted and proudful to introduce our chief guest for ICARP 2021. Mr. Jayasilan Jagannathan sir completed his B.Pharm from prestigious Madras Medical College. Later, he completed postgraduate diploma in marketing management and MBA in marketing. He began his career in sales and marketing. He has total 10 years of experience in marketing. He has worked in various leading pharma companies such as Torrent, Eli Lilly, Sun Pharmaceuticals, and RPG Life Sciences as area sales manager, regional sales manager in various sectors. Proud to deliver about our chief guest, Jayasilan sir is a Honorable General Secretary for Tamil Nadu Pharmaceutical Sciences Welfare Trust. He is also the director for the various pharmaceutical ventures, which includes Nure Chemicals Private Limited, US FDA approved API bulk drugs, Saimera Innopharma Private Limited, PICs approved and R&D, Delvin Formulations Private Limited, Domestic Formulation Marketing, Hybro Healthcare Private Limited, which includes R&D for US FDA. Jayasilan sir has dignified positions in various pharma affiliations and associations, which includes Pharmacy Council of India President, Tamil Nadu State Branch Pharmacy Council, Indian Pharmaceutical Association Chairman, Industry Division, All India, Vice President for Tamil Nadu Branch, Indo-American Chamber of Commerce Chairman, Indian Drug Manufacturers Association Chairman, Tamil Nadu, Puducherry, Kerala State, Joint Secretary, and he also received awards such as IPA Fellowship Award in the year 2018 and also Best Pharmacist Award for the year 2019. With his huge credits and role of our chief guest, now I request our Honorable Chief Guest, Jayasilan sir, to address the gathering. We welcome you, sir, for ICARP 2021. Sir, over to you, sir.
Yeah, respective Principal Dr. Hari Krishnan, other faculties, scientists and students, a formal good morning and good afternoon to all of you. Am I audible? My voice is audible? Yes?
Yes, sir.
Okay.
Yes.
Because being a virtual program, that is an issue. I thought, let me check before speaking. First and foremost, I would like to appreciate Dr. NJR University and the pharmaceutical faculties and the pharmaceutical college affiliated with the university for conducting this international conference on advanced research in pharmaceutical healthcare sciences. Very novel topic. I'm very happy and very proud to see such a wonderful event is happening, that too in Chennai, during a challenging time of pandemic where more than 200, 250 participants are there at any given period of time. Hats off to the university, the senior people, all the faculties who have organized this. I've also gone through the programs where I'm really proud and happy to mention here that there is the topic selected was wonderful. You collected a lot of things. It's not on one particular segment. Since you mentioned about the pharmaceutical healthcare science, you have touched about neural neural degeneration or mental illness or mental healthness, liver, about hepatitis, etc. on the medical side. And of course, regarding R&D and technology side, I have seen topics connecting nanotechnology, exosomes, and even stem cells. All these latest technology speakers were talking not only from India. Almost all speakers were from international repute, from US, Italy, Malaysia. I was very happy to see all those kind of profile. And in pharmaceutical side, drug delivery and that too on natural products is wonderful. Stability studies, post degradation studies. So the topics was not just one particular science. It is really covered the entire spec of the pharmaceutical healthcare. Hats off to the entire organizers. Thank you for inviting me for addressing to these people on this validatory function. And such kind of international program is very much needed because we all know in the current pandemic, only research can drive us and help us for the humanity and the people. And what we have seen in this pandemic last 2 years, we have to be very proud on the pharmaceutical industry because we have seen even prime ministers visiting to a few, 3, 4 pharmaceutical industries for want of vaccines. As we all know, India is the hub, or it is a pharmacy of the world, as we are producing medicines to over 200 countries, including countries like US, UK, Europe, everywhere. So without Indian pharmaceutical company, the world cannot survive today because most of the medicines, what is required for their drug security or required for their normal life, is given from India. And particularly about vaccine, if you see, out of 3 vaccines produced in the world, 2 is from India. That is the reason the entire world is not only looking for India to come out of this pandemic, they want Indian help to get vaccine for their country. So in that situation, if you see, hats off to the Indian scientists who have developed the indigenous vaccines like Covaxin, and they are going to come with nasal vaccine also soon. Next week, Zydus Cadila is going to come with another vaccine which is already tried in child around 12 years kids. So what I'm trying to tell here is, right now, already as a manufacturing hub, India is a leader. Now time has come for R&D. India is going to be the leader. And as far as R&D, in the current situation, when the need arises, the pharma industry and research people, pharmaceutical scientists, reciprocated immediately by giving such kind of vaccines and other associated medicine to treat COVID. Coming back to the R&D, friends, most of these youngsters, young scientists, I just want to touch here about the history of pharmaceutical R&D in India. If you see during our independence, 1947 year, if you see, hardly there was any Indian pharma company or Indian owned pharma company in India. Most of the medicines, what we were using was imported, and it is all from multinations company. And in those time, Indians are well versed with chemistry, particularly pharmaceutical chemistry, synthetic chemistry, and India is the hub of Ayurveda and also Siddha, all those things. So as a result, what was happening is the international companies were having their R&D hub in India, and they extracted the active principle from the natural source. Most of the medicines what we are using, including aspirin, statins, is from fungus. See, if you see, most of the products what we are using is coming from the natural source. And for that, the synthetic chemistry, fermentation, everywhere we were a stronghold, and Indian scientists were helping the international company through R&D, and we were bringing a lot of products outside. And in 1972, what happened is the then Honorable Prime Minister, Mrs. Indira Gandhi, what she did, she removed the product and patent and reduced the process patent to 5 years. As a result, what happened was, one advantage is Indian companies started coming into pharmaceutical. And a lot of Indian companies, since there was no patent, we did reverse engineering and we launched almost all latest product in the world, and we launched everything in India. As a result, our life expectancy grown. We had any type of disease, India had the medicine. And 1972 to 80s, if you see, India grown very aggressively in pharma, and a lot of Indian company emerged. Followed by, we went into globalization during the Honorable Manmohan Singh was the finance minister, and in 80s. So as a result, we started exporting the medicine, and export was zero in 80, and we started exporting the medicine to the world. So what has happened in the history? Two decisions: removing of patent and going globalization made India as the pharmacy of the world, because we started manufacturing all patented medicine in India, and we started exporting the medicine over 200 countries. Because of this, Indian pharma industry emerged. And if today, out of top 10 generic companies in US, 6 is from India. And in today, top 25 companies, more than 20 companies are Indian owned companies. So this is what happened because of this rule. Then what happened is, 2005, Indian government has once again signed and brought patent in. So after 2000, and what has happened here regarding R&D, I want to highlight is, during the year of 1970 to 2005, all basic research in India has come down. Multinations closed their R&D here, they went out of the country. Indian pharma industry did not concentrate much on R&D. We started exploring the opportunity of doing reverse engineering, and we concentrated on manufacturing as our main strength, and we started manufacturing all available drugs and started exporting. So this period was a golden period for pharma industries for manufacturing side, but it is a dark side for our research side. So what happened was, manufacturing India was becoming a hub, but for research we have to depend on the international countries, companies like that. So no drug, new drug was evolved except this Covaxin, first drug approved by in India, and all this COVID drug. If you see, no other drug has been approved. Even today, there was no drug from India approved all over the world. That is the situation of R&D. Why this has happened is, we went out of patent, we started concentrating on manufacturing. Now, after 2005, what happened was, now we are part of the patent. We cannot launch, we cannot do any reverse engineering and launch all patented products no more. Now, Bangladesh is doing that. They are emerging for those kind of markets. But India is reputed for quality and quantity giving to the market. But manufacturing, we are still a leader. But R&D, we have now started concentrating. After 2005, there is no other go. Now, all of our pharma companies is spending more than 15 to 20% of their revenue in R&D. Big companies like Sun Pharma, Dr. Reddy's, all are now focusing on R&D. Now, all multinations, knowing our strength of pharmaceutical strength and IT, information technology for data processing, almost all international companies after 2005 came back to India and started their R&D work in India. So as a result, particularly Chennai, Bangalore, Hyderabad, a lot of international companies started their basic research in India. So why this is, now patent is, we are part of patent. So patent protection is there. So all R&D has come. So future pharmacists, young people who are sitting here, there is no other go rather than R&D. Research is the only way by which India can become a leader in pharma continuously, apart from manufacturing side. And we have all infrastructure in terms of manufacturing, whereas R&D is now only after 2005 it is emerging, and now we are in the peak now as far as pharmaceutical side is concerned. Whereas R&D and biotechnology side, we have to emerge a lot of way. We are far behind of the international countries like US or Europe. We need to catch up there. So for R&D is possible on both sides, pharmaceutical science as well as biotech side. And as far as pharmacy people are concerned, we are needed in both sides, because anytime any scientist finds something, when they want to make it as a medicine or a drug or a tablet, capsule, liquid, injection, pharmacist role is there. Without pharmacist touching a product, nobody, no medicine can come into the world. We can do treat some illness without even having a doctor, but not without having a medicine. Medicine is the root of the healthcare. Why I am telling all these things is that is the reason your college, your university has arranged this international conference on advanced research, and I am sure these 4 days deliberations, discussions, listening, interactions, panel discussion, whatever you had, will be useful for all the young scientists to bring India to the glory of R&D. And friends, young people, in our side, we made India proud by making it as a pharmacy of the world in manufacturing side. Sorry. So whereas in R&D, now the ball is in your court. All youngsters who are between say 20 to 35 or 40, now you have to work very hard in R&D side. Learn all the skills on biotechnology or pharmaceutical science, whatever, wherever you are having interest. Contribute to the research and development of the country and also the pharmaceutical industries. And I'm sure this kind of seminars is going to strengthen you, help you to understand the basics. And the purpose of organizing this kind of seminar is to inculcate interest in research for all people. So don't leave any stones unturned. Concentrate, and we are all here to help you in the industry, because now a lot of money are directed to R&D. Any people coming with some project ideas, product ideas, process ideas, any kind of development. See, for now Indian pharma industry, what we are doing is we are doing a lot of research. I'm not talking on basic research, which I've already told. Now it is increased in pharmaceutical formulation side. A lot of novel delivery system we are working on. You can see even vaccine. I said inhalation. I mean through nasal route we are developing, and we have oral disintegration strips. Lot of kind of medicinal patches. So it is a multi-delivery drug formulations has come in. We have a lot of role as pharmacists. Pharmacists, without pharmacists, no drug can be made or manufactured or controlled or regulated, or it cannot be dispensed. So pharmacist is a drug expert who is there right from the birth of the drug till it is consumed by a patient. He is the only person traveling right from the research to the dispensing. That is the reason we should be very proud to tell we are pharmacists, and I appreciate the entire team sitting here for this conference, scientific conference. I appreciate your interest, and we are here on behalf of Indian Pharmaceutical Association. We are here to encourage the students, and next month there is IPA convention is happening between mid of July. So please participate. It is virtual program. You can participate where a lot of scientific papers, presentations, deliberations are going to happen. So I wish all the best for the youngsters here to grow in their career and make our country and our pharma industry proud. Thank you very much. Thanks for the opportunity given. Good day.
Thank you very much, sir, for sharing your deep knowledge about globalization of India pharma industry and R&D with us. Your words were full of enthusiasm, valuable knowledge, and encouraging to the young pharmacists and researchers. May I now request our respected dignitary, Shri J. Jayasilan sir of today's program, to accept the e-certificate from Faculty of Pharmacy as a token of honor and respect. Sir, kindly accept it from Faculty of Pharmacy, sir. Kindly accept the e-certificate. Thank you, sir.
Thank you very much. Thank you all once again. All the best.
Gratitude is the fairest blossom which springs from the soul. Every celebration is an experience. The external fades away and the internal lingers and echoes in the most deep of our hearts. We are reminded that events like this are one of the milestones in the journey of our lives. As we come to the close of valedictory ceremony, I invite Dr. Dhanlakshmi ma'am to propose the vote of thanks. Over to you, ma'am.
Thank you, ma'am. Good afternoon to all. As all the good things come to an end, so this is the international conference. On behalf of Faculty of Pharmacy, I take this opportunity to propose vote of thanks to those who directly and indirectly contributed to this international conference Conference ICARP 2021, International Conference Advanced Research in Pharmaceutical Healthcare Sciences 2021, organized by Faculty of Pharmacy, Dr. MGR Educational and Research Institute, in association with PCI, Pharmacy Council of India, and IPA, Indian Pharmaceutical Association, Tamil Nadu branch. At the outset, I thank our today's chief guest and resource person, Sri Jaiseelan Sir, Chairman, IPA, Industry Division, Chairman, IDME, Indian Drug Manufacturing Association, President, Tamil Nadu Pharmacy Council. We are really enlightened with your knowledge and presence, sir. Recently, I watched your exclusive interview regarding the remdesivir issue in media, sir. You, sir, correctly suggested how to control the lagging and created the awareness as a pharmacy person to the government sector. We are really proud to be, sir. Thank you, sir. We are thankful to us, Honorable Chairman A.C. Shanmugam, sir, President Engineer A.C. Arun Kumar, sir, and Secretary A.C. Ravi Kumar, sir, for the motivation. I would like to thank our VC ma'am, Dr. Geeta Lakshmi ma'am, for enthusiastic support towards the Faculty of Pharmacy. My sincere thanks to Professor Dr. Shailendra Sharaf, Vice President, Pharmacy Council of India, and Ravi Shankar sir, Raipur University. My sincere thanks to Dr. T.A. Rajarajan sir, Research Scientist, New York, USA. My heartfelt thanks to all the eminent speakers from day 1 to day 4 to enlighten their knowledge and their valuable presence in ICARP 2021. My heartfelt thanks to our principal, sir, for giving constant support and motivated all the faculty members of Faculty of Pharmacy. A special thanks to the organizing committee members, Dr. S. Nandakumar and Dr. Sendil sir for making the flyer, and Dr. C. N. Hemalata for arranging the virtual platform, our event coordinator Mrs. Komal and organizer Mrs. Gedalakshmi, and all the faculties of FOP for their constant support towards all the events. Our heartfelt thanks to all the participants for their active participation from day 1 to day 4 with full stream energy. With this warm words and kind message, we move to the end of the today international conference. Thank you. Thank you, one and all. Be safe, be vaccinated. Thank you, sir.
Thank you all. Thanks for the opportunity. Thank you.
Thank you, sir. Participants are requested to fill the certificate feedback link that has been shared in the chat box to avail the e-certificate. Participants are requested to fill the feedback form through which the e-certificate will be generated to their email before 10 p.m. today.